Just to let everybody know that we've now reached 10 o'clock, so the meeting is formally opened. My name is Natalie Rotherham. I'm Head of Scrutiny. I will only take a short amount of your time as I'm asking the topic group members only to confirm David Andrews as chair of the topic group. If I could have some assent to that.
Yeah, happy to approve David Andrews as chairman for this topic group.
Likewise from Nigel.
Likewise from Lynn.
And likewise from Tina.
Thank you very much. I'm now going to hand over to David as chair of the topic group, as I believe he's got some welcomes to do and possibly some contingency that he wanted to talk through with the members of the topic group. Over to you, David.
Yes, thank you very much, Natalie. Welcome everybody to this meeting of the COVID Step Back Review topic group. A few short announcements to start with. I am obliged to talk a little about the attendance of this meeting. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public can also attend this meeting in an electronic capacity, and there's a link on the Council's website for them to do so. Members of this meeting are asked to keep their microphones and cameras switched off until called upon to speak, and to switch their microphones and cameras off once they have finished speaking. To indicate a wish to speak,
Has David frozen?
to speak. Breaks will be incorporated in the meeting as appropriate, and I'll talk about that a little bit more in a minute. So thank you for that. If I may now just, I'm David Andrews, Chairman of Overview and Scrutiny, Member for Ware North, and Chairman for the time being of this topic group. Could I ask, in the order on the paper, Lynn, would you be kind enough to introduce yourself, please?
Good morning, I'm Lynn Chesterman.
And Jeff, thank you. Jeff?
Yeah, good morning. Jeff Jones, member for Buntingford.
Thank you. Tina?
Good morning, I'm Tina Howard.
Thank you very much. I lost a tad of audio there, but we'll hope that that's a temporary glitch. And finally, most appropriately, Nigel, would you please introduce yourself?
It's appropriate that I'm final, is it, David? Thank you.
No, and finally.
Sorry, I'm Nigel Quinton, Lib Dem member for Hanside and Pear Tree in Welwyn Garden City.
Excellent. Thank you very much. As I mentioned at the outset, at the top of the programme, this is our first, I may have mentioned, this is our first topic group undertaken using virtual means. So it's not something we've practiced. We're not used to it, so we'll see how we go on. One thing that I do intend to work to is regular and fairly frequent breaks. I've got my clock here, and I'm looking to take a short, possibly a 5-minute break, round about every hour within the remit of the flow. I'm not going to interrupt the flow at any stage, but I'm going to go for a number of shorter breaks fairly frequently, just so that we all have a chance to gather our thoughts and, most importantly, stretch. So that's the first thing. We obviously need a contingency, and I'm very fortunate in that two of the vice chairman or the vice chairman of Overview and Scrutiny are in this meeting. So in the unlikely and hopefully non-event of having an IT breakdown at this end, I'm sure one of them will step forward and continue until such time as I can get back into the meeting. Contributors, we've got a number of contributors today, for which I thank them. I just want to make the point that once they've finished their presentation and we've concluded questions and answers to that particular contributor, they should consider themselves free to leave. They're all busy people right at the front end of what we're doing. So without any formality, once you've completed and we've done the questions and answers, please assume that with our thanks, you can leave the meeting. Just a quick point, members. On that basis, it means that you've got to focus your questions. You'll only get the one opportunity, really. Once that contributor has left, we're not going to be able to call them back in. So please make sure that you let me know that you have questions. Otherwise, we could miss out on something. It's assumed that everybody, both contributors and participants, have read the pack. Other members attending during the course of the day will be externally Sarah Wren from Hearts Independent Living, Simon Alton from Decorum Community Action. We'll be hearing from Kate from Community Development Action Hertfordshire, Michelle Stokes from Carers in Hearts, Charlotte Blizzard Welch from Citizens Advice Service Stevenage, Sean Tomlinson from Mind in Hearts, Tom Byrne I expect to see from Welwyn Hatfield. That's not a complete list, but they're the ones that I'm aware of thus far, and my thanks to them and any others contributors that come forward during the course of the day. A quick note on the procedure. We will take evidence over the course of the meeting, and whilst there is some flexibility built into the timing, we have to be careful that we hear from all the witnesses. At the end of the scrutiny, our recommendations will be formulated and a short report will be produced of the members' conclusions and recommendations. The implementation of the recommendations will be monitored by the Impact of Scrutiny Subcommittee in the usual way, which is normally approximately 6 months after the report's publication. To assist members, the Scrutiny Officer will summarise the contributions and conclusions reached by members after input from witnesses during the course of the programme. Rarely. Am I back with you? Natalie, can you hear me?
Can hear you now, but we missed a part
Yes.
of what you said.
Okay, I did get a warning there, but it was rather sudden. I'll just go back at the end of the scrutiny. Recommendations will be formulated. A short report will be produced of the conclusions and recommendations, and the implementation of the recommendations will be monitored by the Impact of Scrutiny Subcommittee approximately 6 months after the report's publication. To assist members, the Scrutiny Officer will summarise the contributions and conclusions after input from witnesses during the course of the programme today. Just a note here, scrutiny is held in public and evidence provided will be available to the public. So I just want us to be conscious of issues of a confidential nature which may arise, which should be framed to protect an individual or patient's anonymity. On that basis, any comments from members of the topic group this morning? Bit of a mouthful, I'm afraid. I do apologise. Any comments from any of you? Yes, no? Thank you.
Yeah.
I would ask that members through the course of the day pay particular attention to item 2, the work of the OSC topic group. And Natalie will now talk briefly on agenda item 3, the remit of the topic group today. Natalie.
Thank you, David. This is for everyone here, but especially for the benefit of anybody who has not been involved with the work generated to date to get the topic group lifted off. So I'm just going to take a quick look through the objective, etc., of the scoping document so that people are clear about what the focus of the scrutiny is about. It's the focus for today's topic group scrutiny is to respond to COVID-19 and the impact that it's had on the County Council's services. Members have identified a number of key areas of the authority's work that it would like to drill into, and hence the witnesses that have been invited to contribute to today's scrutiny. Members are particularly interested in, obviously, how this has impacted on our residents in Hertfordshire, and particularly to identify any lessons learned during the pandemic that can influence any subsequent spikes, including the one that we're currently experiencing. And if there are innovations that have been developed during the pandemic that might actually have good implications for future service delivery that would improve the experience and outcomes for our residents and recipients of our services. Members moving down the scoping document have identified 3 key lines of inquiry, and witnesses have been briefed to address all of these lines of inquiry or to concentrate on particular ones, and that will become evident as you move through the programme and witnesses make their contributions. So the 3 lines of inquiry, just by way of reminder, are: how well did the council manage services? How well did the council instil and maintain trust and confidence? And how well did the county council work in partnership? The answers to those questions should enable members to identify the lessons learned and innovations that have been made that can have future application. What the scrutiny will not be doing, we will not be investigating the work, for instance, of district and borough councils, the services that they are solely responsible, nor the wider work of any of the witnesses, particularly those from community and voluntary sector. So the focus will be on partnership working, but not drilling into those services in particular. The scoping document then continues with a lengthy list of the other areas. We wanted to draw this to public attention to just reassure the general public of the seriousness with which the scrutiny committees were taking the impact of COVID on the wider population and how it's continuing to look into those services as we move forward. So there's a long list there of what the authority scrutiny committees has done to date and what they will continue to do. And that is me finished, David, on the scoping document, unless there are any questions at this stage that people would like me to answer.
Colleagues, any questions? No? Okay. Then we move onwards. And we go now to apologies. I seem to have lost there and be back in again. Can you hear and see me?
Can hear you now.
Okay,
I
thank
can
you.
hear you now, David.
Oh, I can see you.
Yeah, okay.
Yeah,
I don't think
see.
you didn't miss anything because I didn't say anything. It dropped out just at the point when I was about to open my mouth, which is probably a gift, which we should try and spread. Right. Okay. So just a reminder, agenda item 3. So we're going into today's formal scrutiny item, agenda item 4. And can I make it clear that excuse me, this is a first effort for all of us. So I know I will receive a full help and support from you all as we go through. So introduce item number 1. We're going to start with Helen, Operations Director, Helen Manoff, Operations Director and COVID Volunteer and People Assistance Cell Local Resistance Forum, and proceed as per the programme thereafter. Helen, are you with us?
I am. Good morning, Chairman.
Good morning. Thank you. I can't see you, but I can hear you perfectly clearly. Are you in a position to switch your camera on for us? Is that appropriate?
Well, as far as I can tell, I do have it on now, so I don't know.
Yes,
Oh.
you have.
Good.
Okay, thank you.
Chairman,
so much.
may I also ask my colleague Christy Thacker to put her camera on and join the conversation? She's going to be with us for this item.
I think that would be excellent. Thank you.
Thank you. So, shall I just start off, Chairman?
Yes, if you would. And don't forget, we've got a fairly tight schedule today, so I know you're conscious of time limits. Thank you.
So I'll be very brief. Thank you, Chairman. So I am currently working on care services. I'm the operations director on an interim basis for older people's services. At the start of the COVID pandemic, I volunteered to become the team leader of the volunteering and people assistance cell. And it was that cell, which was made up of partner agencies from across Hertfordshire, across all parts of the public, voluntary and community sector, that led what became known as Operation Shield and Sustain, which are featuring in this first part of the scrutiny today. And just a flavour of the volume of Operation Sustain and Shield, which in the end delivered something like 110,000 food parcels to the members of the public in Hertfordshire, 11,000 parcels over to district food banks and other charities. We deployed 6,000 odd volunteers of the 10,000 plus people of Hertfordshire that came forward and offered their services. Hearts Help was our route into services and support, and that took something like 56,000 calls. So a really intensive effort. And I was really well supported in that by Christy. She put this paper together, and she was going to just cover highlights very briefly, but also importantly update you on how we're now approaching the second lockdown. Thank you, Chairman.
Thank you very much, Helen. Yes, Christy, if you wouldn't mind.
Hi, thank you. I'm Christy Thacker. I was the Operation Sustain lead. I'm still the Operation Sustain lead. So I'll just quickly take you through a few of the highlights in the paper and then let you know what we're doing at the moment for the second lockdown. So as Helen said, the Volunteering and People Assistance Cell, VPAC, was made up of Operation Shield and Operation Sustain. We mobilised very quickly. It was a multi-agency cell, and we were able to mobilise residents and also the community voluntary sector services, as well as working really closely with our district partners and our NHS partners as well. So as Helen said, Operation Shield ensured that the shielded residents in Hertfordshire, of which there was about 45,000 in Hertfordshire, received food parcels and also their medicine deliveries as well. And that was done through Mundell, so it was actually a physical operation to do that. Operation Sustain mobilised the volunteers and also the voluntary and community sector to provide frontline services, such as Hearts Help, which Helen also mentioned. So Hearts Help became the phone line for anyone who was either self-isolating or shielding or vulnerable that needed support from our services. And Hearts Help very quickly was able to mobilise and become a 7-day service, as it previously hadn't been. And they were also able to extend their hours from 8 a.m. until 8 p.m. 7 days a week. And just again, as Helen said, just to give you a little bit of a flavour, once the first lockdown happened, there was an increase in about 300% of calls coming through to Hearts Help. Hearts Help were also very quickly able to put in a web form and an email address for people to contact them in various ways. So, you know, it's really important for us that residents of Hertfordshire were able to get the support they required. We also have a number of voluntary community sector providers that we already commissioned as part of community wellbeing, which is part of the adult care services. And what we did was we were able to kind of ramp up their delivery. So, for example, carer support through Carers in Hearts, more heated meals through Hertfordshire Independent Living Service, which is Hills, and also mental health services provided by Mind. So what VPAC was able to do is they were able to utilise and build on existing partnerships with the districts and CCGs. And what was really key is that we delivered a county-wide joined up services. We were able to, as a result of the work with the CCGs and the districts, we were able to put in some real innovative approaches, which kind of jumping forward to now, this second lockdown has we've got well mobilised. So I just want to really briefly touch on those two projects. The first was called Community Help Hertfordshire, for CHH for short. This is a consortium of our CVSs across Hertfordshire, all 10 of them, and also our volunteer centres in there as well, to provide volunteer services for residents of Hertfordshire. So these include volunteer shopping, befriending, walking dogs, keeping in touch calls. What it was doing between the two lockdowns was also helping people that had been shielded come out, so through walks, assisted walks, and moving them into kind of more self-sustainable pathways. The second innovative project that came out of this, and again, just to say, both of these have been jointly funded by ourselves, districts and CCGs, was HEART, H-E-R-T. This is provided by the CABs in Hertfordshire and also the Money Advice Unit. And it is providing detailed financial benefit support for residents of Hertfordshire that have been affected by COVID. So this has included the employment of specialist advisors. Again, this is a county-wide service. And so just to kind of jump a little bit forward to where we are at the moment, VPAC is continuing to work collaboratively with our partners to respond to this second national lockdown. We have a coordinated county-wide approach that we put in place from the first lockdown and have stepped up and remobilised. So we are remobilising and making sure that we are supporting CEV. So although the term shielding is now not used, the term CEV, so that's clinically extremely vulnerable, of which we have 43,000 in Hertfordshire. Between 43 to 45,000 in Hertfordshire. We do have some new people added to that list. So, for example, people with Down syndrome. We are also making sure that we are supporting those people that are self-isolating. So, for example, I know there's been cases of people that have been told to self-isolate, but they think it's okay to pop to the shop. So we're making sure that actually our services are there to make sure people don't do that, make sure they understand, and also that they're supported if they do need shopping. And also, again, supporting our vulnerable residents as well. And that offer of support includes, as I said before, that volunteer support, the hospital community navigation service and link workers, that social prescribing services, food access and pharmacy, and make sure people have their medications delivered, and also the crisis intervention support service. And this is making sure that people that are in short-term and medium-term financial crisis have access to support. So that could be if they are in food poverty or fuel poverty, they will receive vouchers to help with that. So they'll receive food vouchers or supermarket vouchers, they'll receive energy vouchers, they'll receive white good vouchers, and also have access to clothing from the British Heart Foundation as well. So I think I'll pause there because I feel like I've done quite a quick run through.
Yes, thank you very much, Helen, Kirsty. That's very, very helpful. Kirsty, can I just put a quick point to you as opening the question?
I think
I can't hear.
You've frozen again, Chairman, I'm afraid. I think we've just got to wait.
Sorry, I don't know if you got that because I dropped out.
Sorry,
okay.
Froze.
Okay, no, that's fine. We'll have to work with this through the meeting, I guess. Very interesting to hear about the levels of support. How do people access it? Can they access it directly? Do we advertise it directly? Are all of our potential stakeholders and partners in this familiar and competent to get these inquiries to us? Because my concern is around the small percentage of people that fall between the cracks because of demographic or various other challenges that they face. Could you talk a little bit about that for me?
Yes, absolutely. So Hearts Help became our phone line to support, so a gateway to support all of the, to access all of these services. And how we communicated that out is we used leaflets. So there was leaflets distributed to every household in Hertfordshire, signposting vulnerable residents to the help and advice that was accessible from the sector via Hearts Help. So we kept it really simple that people were to go via Hearts Help to access all of these services. There were also letters targeted to vulnerable residents. So the leaflets went out to everybody, but the letters we sent out were targeted to vulnerable residents. We also had social media posts, and we made sure that the county council and district and borough council websites were also updated and reflecting that consistent county-wide offer of going through to Hearts Help. I don't know whether Helen wanted to add anything on that.
Well, I think that sort of household-wide leafleting was an attempt to make sure that nobody, that we could cover every single person in Hertfordshire, and that everyone would have had a communication from us. And then for the shielding cohort specifically, we made it our intention to reach out and contact all of them. So for some people where it was very difficult, we deployed the Hearts Fire and Rescue Service to actually door knock, where we'd tried several times to contact people via phone and weren't successful. So I think we felt at the end of that whole phase one, we'd done the very best that we could do to make sure everyone was sort of tried to be contacted.
Thank you very much. I like the simplistic approach. I always think that you keep it more simple you can make it, the more likely it is to work effectively, or at least not go wrong. I have Nigel. Calling Nigel. Are you there?
Thank you, David. Yes, I'm here. And thank you, Helen and Christy. And first off, thank you so much for all the things you've done over the last 6 or 7 months, however long it is, because I think on the whole, the ACS has done an absolutely stupendous job in responding to the crisis. A couple of things that aren't in the report that I just wanted to ask about. There's no mention in the report of the problems that we had at the beginning of the crisis with PPE, and then later on, and really until quite recently, with testing, particularly in care homes. I wondered if you could comment briefly on those issues. And also, I think it's in here in the sense that you've said that we responded very quickly, but it would be quite useful, I think, to have the dates when things were set up by. I think they've been in other reports that I've seen, but it'd just be useful for us, and certainly for the public also, to understand just when these things were set up and how that related to the spikes that we were seeing in March and April. And lastly, the question from one of my colleagues was, what benchmarking are we doing with other local authorities and learning lessons or providing lessons to other local authorities?
Chairman, shall I try and answer those questions? And Christy, if you want to add anything. I suppose in terms of benchmarking, and Christy might be more up to date with this, but certainly during the time that I was involved in the BPAC cell, there were regional forums that were brought together by MHCLG, where actually once they got their act together, so to speak, they did try really hard to bring authorities into the process and to share learning between us. So I thought that was actually quite effective by the end of the time that I was involved in this process, after a sort of patchy start in terms of our support from MHCLG at the beginning. In terms of dates when we got this going, I remember I volunteered to do this exercise on, say, the Wednesday, and the very next day, not really anticipating what it would entail, the very next day there was a message from government via Owen Mapley, the chief exec, saying that in 5 days' time we needed to be prepared to be operating food distribution services, and that we could anticipate up to 25,000 names, and that was right at the start, I think probably the week that we went into lockdown. And so 5 days later we were stood up to go live with those food deliveries. So certainly the Operation Sustain and Shield was mobilised right at the start of this process, as soon as we'd sort of taken account of the lockdown position. Testing in care homes, obviously that has been an emerging strand of work, really crucially important piece of work. My colleague Tom Hennessy is the lead on that piece of work, and I know that when the scrutiny committee in January-February time considers its piece of targeted work on the impact of COVID in relation to care homes, no doubt there'll be a great opportunity to look into the details of that side of things. I don't really have full information to hand to really share on that topic today. And PPE, again, an emerging picture. Right at the start, I suppose it was difficult to understand what we needed to do, but a PPE cell was quickly mobilised. My colleague Helen Duncan Turnbull, who's part of the VPAC cell, made the link between VPAC and the PPE cell, and certainly now, as we go into phase 2, our our supply lines for PPE are much improved, much more robust. We're supporting the wider health and social care sector with PPE. So, for example, we are picking up delivery of supplies for personal assistants to make sure that they've got the PPE where people are having direct payments. And government portal for PPE is now, I understand, a lot more effective, and that our providers are accessing, our commission providers by and large are able to access PPE via that portal, and then we are acting as a sort of backup service if we have providers who struggle, who can't get the quantities of PPE they need via that route. Thank you, Chair.
Thank you very much. Christy, do you wish to add anything to that? I'm not putting you on the spot, but if
no, fine. I mean, just to say, in terms of PPE for our voluntary and community sector providers in that first lockdown, it was, I'll be honest, we did struggle to get the adequate number of supplies. We were able to fund it, so we did fund the supplies of PPE, but it was actually getting the amounts that we needed. However, that's obviously that was that kind of that real beginning of that first lockdown, and those things have now righted themselves. People have enough PPE. We are checking that and making sure that people have the funding if they need for that. So that we don't have that issue now. So that's all resolved and really good now.
That's very reassuring. Thank you. Sorry, Chair, if I could just come back on one aspect of this.
If you wouldn't mind, yeah, just the one, and then I'll move on to others. We'll go round the loop.
Just in response to just getting clear on what happened when, Helen mentioned that essentially it was at the point of lockdown that everything kicked off. Was there any discussion with central government or within the county council prior to the lockdown formally being announced on the 23rd of March? Because I think most of us thought we probably were going to go into lockdown maybe a week or two earlier. In fact, probably we should have done. So what if you could comment?
Yeah, I mean, we were certainly going through within the county council and within adult care services our business continuity plans. We had a seminar probably about, I'd say, mid-February, which brought together everybody, all the heads of service across ACS, and we were scoping out and scenario planning what we'd need to do to stand up our services ready for go. And I know, although I only sort of stepped into the VPAC role, right on the cusp of lockdown, Chris Badger, who at that time was the operations director, had conversations. I know certainly, for example, with some of the services that Christie commissions to make sure that they were preparing themselves and they were standing up ready to mobilise. I think it's fair to say, well, certainly, the food distribution bit for me was something that was a little bit of a surprise, I have to say, but I can't say there may have been wider conversations going on in government at that point, between government, county council at that point, that I wasn't aware of, but certainly, you know, things were moving incredibly quickly at that time, and yeah, it was that for me that came a little bit out of left field, but you know, I can't say that wasn't more widely understood within the council.
Thanks very much, both of you.
Thank you. I'm going to call Lynn.
Thank you very much. As Nigel said, well done, really good report. I've got 3 questions. One of them, having worked with volunteers for more years than I ever thought of, I see you had 10,000 volunteers roughly who wanted to give their time, and I think you said you used about 6,500. So my first question on that is, did we contact those who were not used? Purely because once people give their time, if you don't get back to them, they will never offer again, and it gives a very bad reputation. On the reports about, I just want from your perspective about working in partnership, where did it not work so well for you? We're all good at writing reports about where things were brilliant, but I'm sure you had some times where things didn't work so well, and probably the most important one, how can it continue when you finish? So thank you.
Chris, did you want to pick up on the volunteering bit?
Yes.
And we can both then reflect on the partnership bit, I guess.
Yes, no problem. So in terms of the volunteers, yes, so there was obviously quite a kind of a rush at the beginning, because people were, you know, we're kind of in this together type of thing. So we did have quite a rush of recruitment of volunteers at the beginning. But I have to say that our CVSs and Team Hearts Volunteering, which is our contract in Hertfordshire that recruits volunteers supplied by North Herts CVS. They have been brilliant at keeping in touch with the volunteers. They provided training for the volunteers while they were waiting to be used. So, for example, we were able to offer mental health training, and in particular kind of suicide training, which was well attended, and you know, we had some good feedback on that. And they kept in touch via email with everybody, kind of thanking them. And obviously, you know, we did have probably more volunteers than we were able to utilise. But also a lot of volunteers had kind of other things going on as well, so they weren't able to volunteer anymore, but they want to kind of stay on the books and keep in touch. So that was a really good relationship, and I think our VCS providers have supported their volunteers really well during this.
On partnership, Kristen.
Sorry.
I'll reflect on partnership working, and then maybe a few more. I mean, I honestly, genuinely believe that the partnership working was one of the absolute strengths of this whole process, and we met every week with a group of district council colleagues. We had a district council rep on the board. We also, I know Christy hosted every week a group of VCS chief exec colleagues, and so we had really good you know, ways of keeping in touch and communicating. And there weren't, you know, I'm not going to say there weren't niggles between us, that's particularly on the districts, where I think you've got that tension sometimes where the county council decides it's going to do this, and you know, it's hard sometimes to take a localised, tailored approach, and sometimes we crossed over each other, but we worked so well together in many ways. So for example, when we were trying to reach out to people who hadn't made contact with us, the districts took on batches of phone calls and did the ringing rounds, and you know, so there was a lot of willingness, I think, to find solutions and to work together, regardless of some of the historic, you know, things that sometimes get in the way. So, and you know, that partnership working in relation to this exercise is continuing. As Christy said, all of the districts and the CCGs have put money into some proposals that Christy developed to create that Hearts team that she mentioned, and the other initiative that Christy talked about. And I have to say, I was sceptical, and I had a bet with Christy that we wouldn't get all those people on board. But I was really delighted when they all came on board. And I think those groups, those opportunities, those forums are still meeting regularly, especially now that we've gone into lockdown to carry on that good work. Christy, do you want to say anything?
Yeah, so just to pick up on that, Helen, the fact that we kept all of these networks and meetings going, even when, you know, in the quieter summer months, obviously the frequency wasn't so great, but the fact that we are now in national lockdown and we've been able to step all of it back, bring back the frequency, I think is testament to the partnership working. And just to mention as well, so the letter that's gone out from the government to people that are CEV, so clinically extremely vulnerable, actually threw a bit of a curveball to us, because we didn't realise that they would be signposting to district website and not county council website for support. And our district colleagues were surprised too. But again, as a real testament to the partnership, that we were really quickly able to make sure that all the district landing pages were signposting to Hearts Help, and all the district call centres were well versed and knew that they had that pathway into Hearts Help. So I think that's really shows how that partnership working has continued, and actually everyone is really committed to that county-wide approach. Also, really just quickly is, again, with the NHS, the partnership working with the NHS, we're now working with them to utilise the NHS monies. This was the money that came out of Major Tom and some the charities money that have come into Hertfordshire. So we're working on that together to make sure it's going to the places that we need the most.
Thank you.
Chairman.
David, you seem to have gone mute again.
I have a slight delay on this computer of about 3/4 of a second between asking for something to happen and it actually happening, so bear with me, but we will get through this. Right, we've got a few minutes left on this sector. Jeff, your question, your comments, please.
Yeah, thanks, David. Yeah, okay. I think actually Nigel's probably covered some of my questioning. Well, first of all, you know, well done to Helen and Christy and all the team in what you did during the first lockdown. Absolutely fantastic work. I'm so impressed with the. My question was going to be on setting up the VPAC and the speed in which you did that. And you've answered the question which I was going to ask, you know, how long did it actually take? And you were saying the 5 days. Yeah, absolutely fantastic. What was this? I'm interested to know, did it just happen that way, or was there ever any sort of previous training, perhaps in some sort of emergency exercise that you've done in the past that helped towards getting it all set up so quickly? Or were you just so fantastically efficient? And the other question on the volunteers, again, fantastic figures. I'm just going to flip. I've got to keep flicking off my screen to go back to the papers. Just bear with me. Yeah, the impressive figures of 10,000 volunteers that we had, but only 5,000 were used, of course. Do you think that may have worked negatively if and when, I mean, I don't think we're using the volunteers so much in the second lockdown, but God forbid it gets any further. Do you think it might have worked out negatively? That's what I'm wondering. Perhaps our communications was a bit too efficient here. And just finally, but again, I think you've touched on this. communications, I noticed that all the requests came through Hearts Help. So that was for users, people requiring assistance. Was Hearts Help used for the volunteers as well, or was there a separate way in, if you like, for them? Thank you.
Chris, did you want to take those last two, and then I could talk about the setup briefly?
Yeah, no problem. So I suppose we already have in existence CVSs, VCS partners that recruited volunteers anyway, and we also had Team Hearts, which was that county-wide contract for recruiting volunteers as well. So what we did was when we did get that kind of big mass of people wanting to volunteer, we made it easier for those people by again saying you can just ring Hearts Help. So what we did is we had a line that went from Hearts Help straight to Team Hearts volunteering. So people who wanted to volunteer were kind of directed straight into there via Hearts Help. So we kept that message simple again because we wanted it all to be, kind of be as simple as possible, that they come in from Hearts Help. But just to say that because of our brilliant voluntary community sector providers, they already had kind of existing relationships. So people were volunteering directly in through the VCS organisations as well. But we were able to coordinate those numbers through Operation Sustain. We were working on coordinating those numbers of volunteers recruited. So that was around that question. And in terms of the use of volunteers, again, yes, we weren't able to utilise all of them just purely because there were so many volunteers that wanted to help, and again, sometimes in reality, the reality of volunteering to somebody when they're thinking, oh, actually, do you know what, I can't do it that day, I can't do that day, the flexibility may not be there. So it wasn't, we weren't able to utilise all of them, but that doesn't mean that we have, that, like I said, we've kept in contact with them, and we've made sure that they can access training and that they're able to volunteer when they want to on it may not be a COVID related item, but keeping in touch calls, those type of things. So we are making sure that in that whole legacy, that we are working with how we make sure that we keep in touch with our volunteers and use them and utilise them as much as possible. And actually during this new national lockdown, we have been able to utilise them straight away with the volunteer shopper pathway, walking the pets, keeping in touch calls, befriending. I feel actually we've been able to utilise them quite quickly this time, and actually they were ready to go straight away. Which again is credit to the CVS organisations with their training and keeping in touch.
Well done. Just coming back on that. Jeff, very quickly, David.
Well, please do. Be quick. Yep.
No, I was just going to mention regarding the volunteers. Of course, that there are volunteers, if you like, informal volunteers, probably in rural villages, that sort of thing. So the 5,000 figure is probably a lot higher.
Thank you, Tina. You mentioned that part of your question had been dealt with through Jeff, but is there something else that you would like to bring forward?
It's just thinking along the lines of the volunteers. How did you actually agree that the volunteers were suitable people to help? Because as I understood it, everything came through to Hearts and then was spread out somewhere. And surely getting 400 names at a time to actually take through the clearing process was rather difficult. Has anything been thought about to streamline that, perhaps? Thank you.
So what we did is they were broken up into where they lived. So the CVSs that were utilising the volunteers did go through kind of an interview process with them. I know we've got some of them on the line who may be able to talk that through a bit better later on. So they were all volunteers were kind of screened, interviewed, had the checks, relevant checks. And that was coordinated through, like I said, the Team Hearts volunteering contract and also the contract with the CVSs. So again, when we had to quickly mobilise, we gave some funding to each CVS in Hertfordshire, of which there are 10, as well as the Team Hearts volunteering contract, and they all worked together to do those checks and to do that kind of screening and making sure that they were matched to the right roles. So our VCS partners were very skilled in that.
Excellent. Thank you very much. I would just like to ask the question. It's Nigel's question, actually, but I think it's one that we've all been all had at the back of our mind, and that is, are you capturing the good practice that you've set up? Because you know, we will need it again in the future. We don't want those. We don't want to do a Cygnus and let those things die. So can you confirm that these opportunities are being captured and we will lay them down for the future?
Yes, absolutely. We're working very closely with our VCS partners. They recently had a webinar as well to kind of highlight the work that they've done together and kind of ideas of going into a recovery. So very much keeping that close working and building on the legacy.
Excellent. Thank you for that confirmation. Thank you very much to both of you. Thank you very much for the team and the huge organisation behind you that I know everybody's working at extremely hard and very long hours under stressful conditions. We do very much appreciate the work that you're doing. So thank you. You've kept beautifully to time. I haven't, but thank you for that. And we hope to hear from you again in the future. Colleagues, we're going to move on to the next phase now. Thank you there, cogent questions. We're now going to go on to the next phase. But as I said, we will be taking short but frequent breaks. So I'm going to call a 5-minute break now. I'm just waiting for confirmation from our IT colleagues that they're in a position to suspend the break. I know it's not exactly on the hour, but some of us have been sat here for over an hour. So we now go on to the next phase, which is an overview of how the authority has worked in partnership with other organisations. And I'm going to invite Michelle from Carers in Hearts, Michelle Stokes, to introduce yourself and talk shortly to us. Thank you, Michelle.
Hi, thanks. Well, characteristics of that response was an enormous amount of pragmatism. The council, whenever we talked to them, were can you hear me?
We can.
Yes, you're getting out fine.
I've got a little red triangle on my screen. The council, whenever we made any kind of request, any kind of for information to be provided, was really responsive. So where colleagues were talking earlier on about the amount of time it took to respond, we certainly had information from the council. If we asked one day, we certainly would have it back the next day in a publishable form, which we found very helpful. So things like Care Act easement, the provisions that the government have made that local councils were able to ease the Care Act that had been previously introduced in 2014. Carers are very concerned about that and wanted to make sure that they understood what services were available and understood what help was available, and we were able to publish that information very quickly. Things like issuing people with PPE, colleagues were talking earlier on about PPE, and we were certainly very keen to make sure that carers, where they were caring for somebody at home, were certainly able to use PPE. The people who were being discharged from hospital who didn't have it. So we only had supportive conversations with the council about that. We were very lucky because we were given some donations where people were closing down. We had some, for example, a science lab gave us lots of masks that were absolutely marvellous, really, and that gave us a little bit of time to get some supply chain going. A cleaning company gave lots of aprons, so we were able to use some of those very early volunteers in just going picking things like that up and dropping them off to carers where we had requests. That was very important to us. We certainly had proactive calls from the council who were asking, you know, what can we do to support you? That was incredibly helpful. I think some of the partnership working in terms of the agencies Christie's alluded to, the Heart and the VCS partnerships. I think for us, it's been very helpful to have that VCS response group so that we can then brief our proactive keep in touch volunteers and staff with what those services are. So people who hadn't necessarily identified yet the Hearts Help offer or any of the individual offers, we were able to make sure the volunteers were mentioning those services to people and mentioning the fact that, you know, care is still available. We can make this safe, and some of the measures that we were using to do so. We were also able to step in, I think other colleagues also did so, where services were withdrawn, not particularly by the council, but where services have been withdrawn by people, services at home. We were able to step in and provide that service very quickly because of that flexibility that we were given by the county council and by Christie's team, basically. So we were very grateful for that because it meant that we could use our professional judgment. We could risk assess those people and get in very quickly. We were very keen to be able to redeploy our staff, and obviously lots of people did this enormous redeployment over a period of time, dozens and dozens of people straight away. A lot of those were certainly in different kinds of jobs in our organisation, but we also were redeploying to places like Hearts Help too. I guess for me, a reflection would be that perhaps it could have been a little bit better at trying to redeploy cross-sector. So perhaps some of the people who perhaps weren't able to work in that first period who worked for the council might have been able to work with us. So perhaps organising some of the information, we should have reached out and asked for maybe some of the librarians to help us organise the information better. I'm not sure what they were doing, so they might have been busy already. But those kinds of things, I think we were just very much in the thick of it, wanting to redeploy very quickly. Setting up that CPA hub was really pivotal to us, making sure that carers who are on direct payments knew that they could get PPE through us or later on through CPA, also get the flexibility in using that direct payment where the person that they have been employing direct, so a PA, was self-isolating, they could use that direct payment to employ somebody else. So that sort of information was really key. And if it hadn't been in one local hub, one central place, that would have been incredibly difficult for the people we support. I think thinking about what I think in the volume of food parcels that were being out there, or that were out there, we inevitably had calls to people who said, you know, I've got this food parcel, I don't want to, what should I do with it? Or I haven't got a food parcel, I need it. And I guess that's always inevitable with it, you know, 100,000 food parcels being delivered. But again, any kind of resolution of that was really swift, and that means that people don't think that it's inefficient. Very helpful. Thinking about obviously a lot of services have gone online, and very quickly we were able to get a response, not just from the county council, but from district councillors who supported us financially to be able to provide some people that we support with tablets. So although they might not have been included previously digitally, they're now online and they're engaging with us. And for some of them, it's the first time they've been able to engage with us. They come to face-to-face meetings because they weren't confident to leave the person that they normally support at home, either on their own or with someone else. And some people, you know, journeys to Hertfordshire's not a small county, they just had never got to a point where they were able to do that themselves. I think we have some concerns still about care homes, and I think we'd like to see some examples of good practice that are being used locally, where carers are able to visit relatives in care homes. I think we're still very concerned that things like visits through glass don't work for people with dementia, and don't work for people who have kind of sensory impairment. If you're blind, being the other side of a glass is completely useless. So I know there's been some great examples of good practice locally, and I think we should be shouting about that more. I think that'd be fantastic. I think I know that the council have asked to become part of the key worker pilot, which is where an individual member of a family might be able to be designated as a key worker and therefore be regularly tested. And I think that will be incredibly helpful for all those people who for months have not had a visit, or had, you know, through glass visits with the people that they have previously been supporting, and, you know, members of their families. I think it would be incredibly helpful, because it would also some of those care homes, for some of those care staff that, frankly, if the NHS staff have been on their knees, which I completely can see, some of those care staff have been too. They've been supporting people all the way through this, and I'd like us as a county to be able to shout about that a little bit more as well. Some of that good practice, some of that shout about would be great. I think we need to respond to the fact that we've had lots of people who have said, just at the moment, I don't feel able to have my carers break or my domiciliary care visit because I don't feel confident having people up, you know, in my home. I think we would do well to respond to that, and to people who don't want to use day services for similar reasons. We don't want to have more people in contact with people that they perceive to be vulnerable and who are vulnerable. And I think we should be thinking about some confidence building. We're currently doing an exercise, which, you know, obviously we will be talking to members and officers about, which will reflect on the sorts of things that will give people confidence. So this isn't about false confidence, but reassuring them that actually, as a very small scale care provider, we have never been short of PPE. So we've a lot of people have had that perception that there's been a massive lack of it, and they won't get supported in their own home in an appropriate and safe way. But actually, we've run short, but we've never run out. And those messages, I think, are really important to get across. I think that some of the sustainables for the future, so things like more proactive calls for carers, more proactive contact, that's something that we want. We now will not give up. Since lockdown, we've applied to the lottery to say we love doing this, we want to do it more. Thousands and thousands of carers have had calls by some of those volunteers that you were talking about before, but also some of the staff. We want to carry that on. The lottery said they're supporters in that, so we see that as an ongoing service that the lottery are going to support us with. We've had some support from county councillors to make sure that getting that digital offer to happen and be sustainable is also part of the long-term plan now. We've all made our peace with Teams and Zoom and all other platforms, and we see that as ongoing now. I don't know if you want me to stop there, because if there's any questions, I'm conscious that there's quite a few of us to do in an hour. 45 minutes more.
Indeed. No, I'm going to pass over to members now for brief and cogent questions, please. Members. Any questions to Michelle?
How does it work for your constituents? I want to know.
Nigel, go ahead.
Yeah, sorry, David. I thought we were going to do questions at the end of this session.
Yeah, no, it's. I think with Michelle, we'll just do the questions now because that was very full and comprehensive. So just very quick questions now that spring to mind, please.
Sorry, call me slightly on the hop.
Well, if you want to wait till later, Nigel, that's not a problem.
If I could, yes, please.
Yes, please. Okay, I'm just
what Michelle has said.
Okay, I'm just going to come in very quickly with one which flagged up fairly early on. We're talking about various people. What are we? Is there still hard to reach out there in your field? And if so, what are you doing to find them?
We don't wait to reach. We've wanted to make sure that the people that we already have registered, and that's about 33,000 family carers in the county, we're proactively making calls. We're not waiting for them. They're on a priority list. So we started with carers who were over 70 with their own pre-existing health condition, and we've added people in priority batches since then. So we're going through BME carers, for example, for all the reasons we can see in the research that's been available more recently. Outside of those people already identified, we're also doing some work with the press to get some case studies out there, working with social media to get some of this out there to say, you know, you're a carer, we want to notice you, we're here to support you.
Okay, many thanks. I'm now going to pass over to Herts Independent Living. I'm looking to Sarah. Are you with us, Sarah?
I am with you. Hello.
Hello. Good morning. Welcome.
Great. Lovely. Well, I'll quickly run through just a few key points in addition to the written submission that I've sent to you. In terms of the overall coordination and management of resources, I think the response from the County Council has been excellent. The VCSE meetings that we were able to have together have been extremely successful, and we really appreciated those. However, there was an issue certainly for us with PPE at the start, and that was because we are not an organisation that usually requires it. So we're not registered with the Care Quality Commission. We were able to draw on some relationships with private sector businesses that donated to us, and that was actually really, really useful. But the fact that the County Council was able to release resources and to say to us, yes, we realise this is an additional cost that you're going to have, that was very important. Also, the County Council were very proactive in actually making sure that we were all properly resourced by paying us 2 of our contract payments at one time. They made sure that there wasn't a cash flow implication when we were incurring more costs, and that again was really useful. I do have a concern that we may not still be reaching some of the most vulnerable in our community, and that is because there is still a large proportion, particularly of the older population, who are not digitally engaged and who do not want to be or who are unable to be. Also individuals who are not happy to use the phone, maybe because they have a hearing impairment and find it difficult. And one of the things that I would urge is that we really proactively make sure that in-person services are still taking place where they are needed, so that we are reaching those people. Just one other point I would make is that although, of course, it's fantastic that we've had so many volunteers come forward, the resilience of the service response from the VCSE sector has come from the large pool of paid staff that we all have. Because actually, when we need really resilient services, I mean, for example, at Hills, we're now up to, I think, about 350,000 meals that we've delivered since the crisis started. That is not possible with using volunteers. You have to have the resilience of paid staff day in, day out. In terms of messaging, again, I think the messaging has been very good across the County Council. I think that it's been great that we've been able to share resources. Certainly, we were able to access HCC's comms team for advice when we were getting a lot of media inquiries, and that was extremely useful. However, we have come across some issues with the central messaging from the government that, in fact, I think we could try and counter as a county council. So, for example, the information around, staying at home when shielding was first brought in, we discovered that a lot of family members stopped visiting their loved ones and were therefore relying on the county council to provide food packs, when in fact they were probably perfectly able to go out and shop and provide food for their loved ones. So making sure that the information was clear about what people could do and that they could still carry on supporting their family members, I think would have been useful. Also, there have been an awful lot of keep in touch calls, and whilst they are very useful for certain parts of the community, we've also had feedback from some clients that they've had too many keep in touch calls. So some sort of central coordination to make sure that everyone is being contacted but not being overly contacted by too many agencies, I think is important too. So finally, then, in terms of the partnership work, I think the partnership approach has been brilliant. I think across sectors, there has been a really positive response. I think it's been great for us as VCSE partners to work closely with health and social care and between ourselves, of course, which we already do. But I think the one area of lessons learned that I would want to talk about is gaps in provision, because I don't think it's always been absolutely clear where services are still operating as normal and where, in fact, they have ceased. And my sort of small concern around that is that there may be services that members of the public used to access that were important support mechanisms that have actually stopped operating during the crisis, and therefore people may not be being supported in a way which we think that they are. So those are my general comments. Very happy to take questions.
Thank you very much, Sarah. We'll take questions at the end of hearing the evidence from the other parties. So thank you for that. Members, note your questions, please. A couple appearing in chat there we dealt with, and we've had an offer from Helen to do some work there as well. I'm looking now to Simon Alton. Good morning. Are you with us? Are you there, Simon?
Good morning, Chairman. Yes, I'm here. Can you hear me okay?
Yes, we certainly can. Thank you very much. Good morning to you.
Good morning.
A brief presentation, please, and stand by for questions at the end of the session in approximately half an hour.
That's fine. Yeah, thank you, Chairman. So I'm the Chief Executive of Community Action Dacorum, and we run the volunteer centre in Dacorum, as well as providing the services that were mentioned by Christy earlier for CHH. And I was a member of the Operation Sustain group early on, so which is kind of why I'm here today, I think. We're quite typical of CVSs across the county. So my experience and the experience of the colleagues that I have in other CVSs in different districts was quite similar. And one of the real positives of the way that this has played out within Hertfordshire is that the six of us now are talking much more frequently, much more honestly, and working much more in partnership because of the work that has come about over the last few months. So I just wanted to talk a little bit about the volunteering parts and then some of the support services that we've done, just to try and put some context in there if I can for members. One of the things that started very early on was that Team Hearts Volunteering, which is a county-wide volunteering approach, contacted all of the volunteer centres in order to try and coordinate the recruitment and deployment of volunteers across the county. This happened within days of the initial lockdown being announced and was in place before the first lockdown started. And as often people quote, 10,000 names came forward, but I think that needs a little bit of context just to help understanding. So within those 10,000 names, there was people who had volunteered for Team Hearts Volunteering. There were people who had also volunteered directly to volunteer centres, and there are people who'd also volunteered with national or mutual aid groups locally. So that 10,000 names is probably slightly higher than we would expect in reality because of duplication. Another thing that I just think is worth understanding in terms of analysing the impact there is 75% dropout. 75% uptake rate would be, under normal circumstances, our expectation from people who put their names forward. People think it's a great idea, and when it comes to a reality check, they tend to, about a quarter of them drop out. So when we think of 10,000 names, really we're talking about 7,500 potential volunteers at best, I would have thought. And of that, 5,000 to 6,500, depending on who you count, people were placed within COVID-related volunteering opportunities. But I think one of the real strengths that came from it was because the volunteer centres and CVSs that are operating them are operating locally, the people who were not contacted or not able to be used through that initial sort of COVID-related stuff were able to be used elsewhere. And I know we were able to place people into a number of roles with local charities and local clubs, particularly, interestingly, volunteers who want to be trustees. And that's because of the nature of the volunteers who came forward. They were generally people who were in business, and they were, suitable for that sort of role, which is difficult to place. So it's been very positive for them and for the clubs and societies who've struggled traditionally to recruit volunteers. We're also using volunteers already for the second lockdown. The pool of volunteers that we have are being deployed already into shopping and various different services under the Community Help Hertfordshire contract that Christy mentioned in earlier evidence. So they are there, and I think we've also worked with and coordinated where it was possible mutual aid groups as a sector, and that's been really helpful to try and get information and direction from the work that's been done, not just across Hertfordshire, but on doorsteps and in streets, and those very small micro and mutual aid groups that were set up very quickly. So the reason that we wanted to be involved was about safeguarding, particularly, and making the process of volunteering safe. We did checks and vetted all of the people who came through Team Hearts Hertfordshire, Team Help Hearts, because they came to us and they were checked before they were put out. Some of the mutual aid groups bought into this as well, and we were able to run checks for them, and that gave them some credibility. That's not necessarily the case for all of the national and local groups that were volunteering. That was just a bit on that. And then in terms of delivery, we delivered particularly some services, some shopping services for people who were vulnerable and not shielding, addressing anxiety, which I think, the King's Fund have come out and said was a bit, and that couldn't have happened without, or the fact that happened meant that we've created this CHH group, because Community Help Hertfordshire came out of this process. So one of the positives that came from the VCSE meetings was that we came together, we worked in cooperation rather than in competition. And it's that change from competition to collaboration that, if we can keep that, that'd be really good. And that's thanks to Christy and Helen, who catalysed us all around that. PPE was a problem. I think, I would echo the comments that my colleagues have made. We had a donation from a tattoo parlour, and accessing PPE centrally was not easy for us because of the processes that were in place and the fact it was needed elsewhere, really. Community Help Hertfordshire, I think that's another thing just to mention. The services that CVSs are running locally and the coordination that we can have in districts allowed us to support county by accessing far more small and local VCSE organisations. So that delivery of shopping, befriending, dog walking and keeping in touch, there are those that were involved directly on a county level, but also at a local and district and borough level was also there. we also did a lot of work on self-sustaining and digital training. We worked with a lot of people who needed to build their confidence, and our colleagues had digital champions that helped address that. The biggest issue that we found was digital poverty, and people not having the devices or not having the connectivity to get involved. So I think that kind of was the bit of the evidence that I think overall the communication from Herts County Council was great. I have colleagues who work with other counties and they are envious of the relationship that we were able to build, particularly with Christy, and the fact that we had the Operation Sustain meetings. People are in absolute awe elsewhere in the country that we have that relationship with our council. So I think that's well worth recognising and congratulating people for bringing together. And that's more or less what I wanted to say, Mr. Chairman.
Thank you very much, Simon. Excellent. Thank you for that. We will move swiftly on, if we may. Kate, I saw you earlier. I know you're there. Good morning again.
Good morning.
Good morning, Kate. Hello. Good morning again.
Hello again. Thank you.
So we're going to hear now from Kate, who's Director of Community Development Action, or CDA, as we know it, Herts. Over to you, Kate.
Hi. Good morning, everyone. And really would like to say, add to my own colleagues, Michelle, Sarah, and Simon's stories about working in partnership. We are very much, we don't do the what I call frontline services like my colleagues. We're very much enablers and facilitators. So we cover rural as well as urban communities. And that has helped the people living in rural areas with thanks to a capacity building grant from county, to enable us to actually improve our own digital skills and expertise. I don't think we can quite be called experts now, but we did a survey to all our rural communities, and I'm delighted that 90 plus we have established as rural support networks, and we are continuing to work with them through other grants that we've since managed to secure. We run networks of village halls in East Herts, North Herts, Dacorum, and some virtual connections with Village Hall. Delightful, magnificent volunteers in Hertsmere and St Albans. Everybody has stepped up, and we really want to congratulate all of the people that we certainly work with. And doing our enabling function with village halls, we arranged to have very regular coffee mornings with them. And this, to the delight of everyone, brought them closer to ensure that their liabilities, their restrictions about whether to open their centres or not. They were thankful for what we call our Village Hall Advisory Service, which is supported by our national body, ACRE. And this increased our connectivity, if you like, with our village halls almost fivefold. So we had to also reconsider and reconfigure how we were actually delivering our services, which is normally face-to-face, working with our communities. And the village halls, and they are still now, we're in second wave, they're still calling us because the guidelines from central government is sometimes quite confusing, fuzzy, and we are sometimes struggling with which is the most appropriate and definitive information that we can share. Working in partnership with county, and again, with my colleagues, Christy and her team and Helen, etc. I mean, bringing us all together at such a short space of time was truly commendable and memorable. And we continue to have these conversations. And also keeping in touch for us at CDA, keeping in touch with colleagues who are actually delivering services has benefited through this partnership, because then we can reassure the people of the services that are available. So we could signpost them to, and with accurate and solid information, was, you know, the feedback from our service users were, you know, commendable again. We're also delighted to be part of the CHH initiative, because what we are doing with that is that we are supporting our rural support networks. We are lovingly calling them RSNs, who in turn then know exactly what other support they need in order to provide individuals that they know of within their villages and their little their localities. The support that we've all, you know, we've talked about, for us it was capacity building. We're you know, a very small team of individuals, but we talked earlier about the recruitment of volunteers. I managed to redeploy my staff over to help out with the huge amount of volunteer assessments, and that was good for us, because you know, my own workforce, because they were all quite specialists in their areas of work, could actually then provide a generic help and with the assessments. So that was a good thing for both my organisation and also supporting the county-wide initiative. Because we've all talked earlier about digital exclusion and inclusion, we have managed to secure a small grant from Clarions Futures, which is a housing association, to provide some digital learning in the rural areas. And we're also looking for IT tutors in this field. So that's being kick-started, and within that grant, we also have a pot to purchase some devices for people who don't have any devices. Part of our, we have quite a diverse network. So we work with our BME communities, and that also includes our Gypsy and Travellers. I'm delighted, thank you, Christy, again, that there is a capacity building for GATE, which is Gypsy and Traveller Empowerment, and we're helping to support them with any infrastructure needs that they have. And also my connection, I'm a volunteer with Hearts Equality Council and Stevenage World Forum, so I can help bring stories, and if there are any gaps within the communities, and they were initially, one feedback about information that came out of provided by Hearts Help was everything was in English. So we you know, once that was fed back, and different scenarios were developed and produced, and thank you for that. I think I'm going to stop there now. Chair.
Kate, many thanks. Appreciate it. Lovely to see you again. We'll come back to you shortly with any questions we have. Thank you very much. I'm now going to pass over to Sian Tomlinson from Mind. Sian, are you with us? Good morning.
I am with you. Thank you.
Lovely to hear you. The floor is yours.
Thank you. So thank you for inviting me to talk to this meeting. I suppose just in a response to some of the questions, I think that I would echo most of what's already been said by my colleagues in terms of thanking Christy in really mobilising us very early. And somebody was asking for dates, and we had our first meeting on the 12th of March, which took a while to organise. So Christy was thinking ahead, and her team were thinking ahead and getting us coordinated quite early on. Obviously, the lockdown started on the 25th, and then after that we met because we met in person on the 12th of March, and then after that we met on Zoom or on some other platform that we could organise. So it was very good. And I suppose the only thing I would add to everything my colleagues said about that is that at that time it was really important for peer support. I was really feeling the heaviness of the responsibility of closing services when I knew that people's mental health was really vulnerable as a mental health organisation. And there are 2 Minds in Hertfordshire, and we're quite a small one. The larger one is Hearts Mind Network. They were very involved in mobilising crisis care, which was wonderful. And we were supporting them with deploying some of our volunteers to support their the crisis helpline that they mobilised very quickly. I suppose, so in terms of thinking about volunteers and the assessment, kind of responding to some of the questions that have already been put out there, was that over 600 people identified that they would be pleased to be volunteering for mental health support. So we very quickly mobilised Spot the Signs training, and over 600 volunteers were trained in Spot the Signs Save a Life, which is suicide prevention training, and mental health awareness, so that those 600 volunteers were kind of ready to go in terms of training quite quickly. Obviously, from that, we had to make sure that they had DBS checks and they were processed well through that as well. And we had, as a mental health organisation, we had about 80 people. We had about 80 volunteers that came forward to us. And by the time we'd interviewed them and talked to them about their availability and that sort of thing, that got whittled down to about 40. And we trained 40 people in doing keeping in touch calls, and we are now doing keeping in touch with about 650 people. Very early on in March, we identified all the people that we had, and it was about 250 that needed the keeping in touch call. So you can see how that's grown over the period, because now we're keeping in touch with about 650 people, and that some of those are we have assessed are quite high risk of hurting themselves or worse, and so we are some of those people. There's about 60 people that we call, some of them twice a day, but most of them once a day. And we are quite concerned thinking about going forward about how they're going to manage over the Christmas period. Some of the feedback we've had from the people who use our services is that they feel quite forgotten in terms of saying, well, it's all very well, everybody's worried about people dying of the pandemic, but they were feeling quite suicidal and feeling that we'd let them down because we weren't running groups. So although we were keeping in touch, we never closed in terms of being on the phone. We got a new phone system, and again, you know, commissioners were wonderful. They paid for us to get 100 new telephone lines so that we could deliver those keeping in touch calls and mobilize all those volunteers. So that was amazing. We were also so we started groups again in September, and now we've had to stop doing groups again because we don't feel it's safe, and it's obviously against the guidelines. But again, we're going to continue seeing people on a one-to-one basis, which we feel is safe. We weren't able to do that back in March because we didn't really know how to keep people safe, and we were having to on a huge learning curve. And I would say that's the other real thing about the COVID response group that Christy and her team brought together, was that the other CEOs and myself, it was that peer support, that we were all in it together. We all didn't know kind of what to do and how to do it best, but we were working together, sharing resources, and yeah, just really helping each other out. And it was a forum where we could just go, wow, who knew? And we were, we were exhausted because I was working more hours than I've ever worked in my life, just trying to make sure that we were getting in as much funding as we could. And Hearts Community Foundation were amazing. They turned around grant applications really fast. So, yeah, that was it really was people who the speaker who earlier asked for dates. It really did happen fast. Is there anything else? I would just say in terms of volunteering as well is that I would echo what Sarah said, is that although the volunteers were wonderful, if I didn't have a core staff of kind of 35 people that were supporting those volunteers and continue to support those volunteers, that really would not work. Because, you know, people who volunteer often volunteer because of their own lived experience, particularly in mental health, and therefore they are vulnerable. And I had to think quite carefully about how we were going to support them. I'm not going to go into detail on that, but if people want to know, I can send an update later on how we are making sure that people's well-being is being cared for. And my staff I have had to think quite carefully, because when they're having daily and sometimes twice daily calls with people who are suicidal, it's quite heavy and hard on them as well. So we kind of think quite carefully about how to maintain their well-being. The thing about the concerns going forward, what I would say is that digital exclusion, as some of the other speakers have talked about, is quite a big issue. And also just about how we support the people who feel they're suicidal and that feel let down because we stopped running groups due to the government guidance and the government rules. So I think I'm going to stop there. I'm sure everybody's got lots of questions, and if I can, if people want to send questions to me, and I'll try and respond. I'm mindful that we're running out of time. I'll try and do that. Okay, thank you.
David, have you frozen again?
Right, I lost you all there for a moment, or rather you lost me, which amounts to much the same thing. I hope I'm back in the room now. So Sian, yes, thank you very much. We will be proceeding onwards towards questions shortly, but in the meantime, Helen has very kindly offered to come back and just share a few other thoughts with us. So Helen, are you there?
Yeah, Chairman, yes, thank you. I suppose, you know, it's really interesting to hear the feedback today from VCS colleagues, and we've been really reflecting hard within the department, along with our partners, about the lessons we've learned during the COVID period. And I did want to offer the committee some assurance that, you know, we've taken on board an awful lot of learning and an awful lot of reflection, and we fed a lot of that information into our winter plan for adult social care services. So I know one or two of the members of this topic group sit on adult care and health panel, and on Monday then the plan for adult care services for the winter, particularly for this COVID winter, was presented to the panel. And the plan is extensive. It covers what we're going to do across a really wide range of activities in relation to COVID. So I won't go into details here, but I did want to say that, you know, in terms of some of the things that have come through, we're really keen to focus our energy on how we support people to keep in touch, that importance of communication, those human dimensions, how we can learn lessons about well-being for people when they are not in touch, and what we can do to support that, how we can make sure we're coordinated around keeping in touch with carers, how we can make sure that we're doing what we can to support carers to take breaks, how we can support our day services to remain open in a safe way, how we can offer alternatives where people feel unable to engage with those services because they're worried about possible risks. And also about technology, we are looking at having some digital outreach officers who can help in terms of that digital exclusion concern that we've heard about this morning. And the plan also sets out how we will, you know, be sustaining our commitment to work closely with the VCS partners as we go into the next phase. And final point for us, I suppose, is about being very flexible, very agile. We know we'll have to respond. We're really keen to pick up that intel to know what we can be doing better. And so, you know, just wanted to offer that assurance to panel that we are really thinking carefully about this winter and what we need to be doing. Thank you, Chairman.
Thank you very much. That was helpful. You've swept off a few leaves there. Thank you very much. Excuse me. We now go into the question phase. And at the end of the question phase, we were due to have a 10-minute break, which I will keep in the diary, but in the timetable. But don't feel in any way limited, colleagues. I'm prepared to allow as much. This is a complicated series of presentations we've had. I will allow as much as is practical for questions. So in this order, I have Lynn, and then followed by.
Thank you. I think we've lost David. So if I just go, can anyone hear me? Yeah.
I can hear you, Lynn.
Yes, go ahead, Lynn.
David, we've got the problems with.
Okay, thank you. I just wanted to thank everybody for their presentations and say that I was very empathetic to all of you, having been a CEO in the voluntary sector for 30 years. So I was reliving everything you were saying, really. I'm just going to pick up some bits because I'm sure my colleagues are picking up others. But the bits I want to pick up, first of all, I'd like to ask all of you, although you were talking about digital poverty, which I think is another issue that, but I'd like to ask the comms team later on, but get your take on it first. Is the perceptions from your service users, who are the trusted routes, or what are the trusted routes of social media communications? I think we've heard so much about scams and fake news. Do you think your service users prefer that medium or another? That's my first one. Then I don't know if you've seen the reports, I'm sure you have, but there was a very interesting bit from Power, and I'd like your feedback on, and that was about, in terms of lessons learnt, that the charity sector should be more involved in the strategy and taking forward the issues that councils are facing. So is that a way forward? And I'd like your feelings on that. And finally, Simon, I was really interested when you said that you'd moved away from competition to cooperation, which I thought was brilliant. But I wonder if the main reason for that is when you sit around talking about issues in the voluntary sector, quite often we never opened up because we were worried about competing for funding, and perhaps that was the change this time. And it just makes a difference between, if you're not arguing over funding, perhaps, you know, you can do the cooperation better than the competition. Those are my three ones, Chair. Sorry.
Thank you very much, Lynn. I just make the point that at the outset of the meeting, I failed to give apologies from Riaz Khan from Power. So Power are not with us today, but I'm sure that the question has been noted, and perhaps we can ask Power to give us a written answer at some stage to that question. In the meantime, colleagues, who feels able and to step up and answer some of those questions? Simon, you look as if you might be.
Thank you. I was addressed specifically about the competition and collaboration point, and I'll start there, and then that hopefully buys thinking time for the rest of my colleagues to be able to answer some of the other bits. My take would be that your point, Lynn, is pretty much on the mark. Because funding wasn't the issue for us, we were able to look at how we worked together. We weren't fighting for the same small pot of money. And the difficulty we have all had, I think, financially, is that during the COVID period, the part of our income that has really got hit hardest is the unrestricted funds. So we were very grateful for the council, and in fact, I would say all of our funders who just said, continue with your work, you have the funds, get on with what you need to do. The problem is those funds are restricted to delivering specific things. And because they're specific things, we can't use them to keep the lights on in our offices or run the photocopiers or pay for the things that just come out of our general funding. And that was the biggest challenge for us, is to have funds that saw those overheads done. Now, one of the things Herts County Council did very early on is that they came to us and they said, here is some money to keep you running over this period. And we don't care what you're spending it on, we just know you need it. And that is really at the heart of why we were then able to come together and say, right, how do we together create something that works for the people of Hertfordshire? So you're right in that competition came out of fighting for the same funding. And I think there are other things. I think the fact that it's a global crisis meant that collaboration became the obvious way forward once you'd taken away the barrier of how we're going to pay for our staff and things. And I think all of those factors meant that it worked. Where I think, for me, this is important looking forward, is that as a model for the county, it provides a far better service to the people who need charity services. It provides a county-wide approach delivered locally, and that local delivery, which uses all of the local knowledge, which uses CVS's and our colleagues in the infrastructure bodies working with organisations that otherwise wouldn't access that level, is really powerful, and it makes the best of what we've got. The other bit that it does really well, and we recognise this about halfway through, but is that instead of trying to create bids that in the competition model, we create a bid that means we have to do all sorts of things. So we might know nothing about mental health, but it's a part of the bid that we're putting forward, so we have to go and run it. Whereas because we were working together in such a way, we could easily just say to Sian and her team, for example, we've got this bit running, we need your support to do this bit of it, and the answer was always yes. So for me, that's one of the legacy points I think I'd love to keep, and I could talk about it for hours, but I'm going to stop there and let Kate, because she's put her screen on, continue with the comment.
Thank you, Kate. Before you go.
Thank you, Simon. Thank you, Chair. And thank you, Lynn, for your question. I just wanted to, I would cover, oh, my screen's looking very green. Just to cover about future going forward about strategy. And thank you for your observation. It is very key to, in order to all of us to develop joined up, cohesive, inclusive services, if we were all at the table from day one, so that we can consult immediately rather than public bodies talking and thinking about it themselves and then coming out to us. We could save so much time where all of us are sitting at the table at the same time. You talked about trusted, comms, etc. We experience, I don't know how many fold about our social media and people accessing our website for information. So I can only assume, I know I shouldn't, that we were a trusted source of information. And also the feedback was there were lots of thank yous because it saved them a lot of time into fighting their way through all the different guidelines, etc. So we were quite precise. And then if we didn't know the answer at the time, we would go back and certainly go back to them. And digital inclusion, especially in our rural areas. So we were delighted. It appears from Clarion Housing that we are the first pilot for them to run a service about digital inclusion in rural areas. So I'm just chuffed. Can you see? So over to my colleagues about sitting at the table.
Thank you, Kate. Who's next? Anybody else stepping up here? Hello, Michelle.
Hi.
The floor is yours.
I just wanted to really say that I think it's really important that organisations are able to have a presence and build their own brands. So I think that their unique specialities are something that comes across in the relationship that they have with various different parts of the population. So I think where some people think of us as frivolous as you know, town centre stalls or whatever, or a bit of a Christmas message in the paper, it's all about building trust, isn't it? And all about building reputation and making sure that people understand, using cases or whatever, to make sure people know that we are trusted providers. So I think some of the ways in which that's helped is by not being too precious about having to have 25 logos from every single funder on every single letterhead. So having a reasonably relaxed approach to that, although I do think there are some of those jointly delivered projects that I think we should try and wrestle with how they look to other people, because I think if we can get people to go directly to organisations, it's people being passed around, which I think is absolutely invaluable, because they'll never get to the end of the passing around if they try it.
Thank you very much. I'm going to go now to Nigel. Before I do, we've gone over time, but I intend to continue within reason for as long as it takes, certainly for the next 10 to 15 minutes. So, Nigel, succinct but effective, I'm sure.
I'll try to be. Thank you, David. Yeah, so a couple of observations from the reports and questions that follow on from that. One for Kate, who mentions the need to encourage the new NHS bodies to join in. If she'd like to enlarge on that a little bit, that would be helpful. Also noted the comments in the Hills report about the communications using them as a route for communications in future. Maybe one for Andrew to answer on the next session. Question on the keeping in touch calls, been raised by a couple of people, I think, in terms of coordination of that, so we're not overdoing it or underdoing it for that matter. Who is coordinating that, and is that now sorted? And lastly, I think Power mentioned that Power had done a limited survey of the public's experience, but I think somebody else had raised that as a requirement, that something we ought to be doing more of. So what plans do we have? And that may be more to the county rather than the voluntary organisations, in terms of surveying the public on what their direct experiences were through this period, and when's the right time to do that, of course. And lastly, could I just add my thanks to everybody on this call for the work that you've been doing. And I think I was particularly struck by what Sian was saying, but I'm sure it applies to all of you. I mean, the work you've put in is just phenomenal. Yeah, very much in awe of you. Thanks very much.
Thank you, Nigel. I'll just hopefully can cover your reference to my response to this panel. Was that as part of our Operation Sustain and Shield, I didn't feel that there were colleagues from the NHS environment. All of us just came in, the public bodies were there, local authorities were there, adult care service and colleagues. So I'd still think there's a bit of a gap there, that they don't quite understand our role, what we have done, what we can do. I hope from the voluntary sector webinar that we did on the 5th of October helped them understand that we are here. We've all got the same passion about the service. How can we support? We all do it differently, but it's all of value. So really would like them to be more engaged with us. Thank you.
I don't know if you're happy for me to respond to the question that was raised for Hills as well. Yes, I think it's just a case of using all of the mechanisms that are currently available. So certainly we were distributing a lot of information that we felt that people needed, but equally we could have delivered specific information targeted at some of the most vulnerable people, since we are seeing thousands of them across the county on a daily basis. The kit call issue and the central coordination of that, I think that is a real issue for all of us. And I know that some data sharing was done, and I know that there was work that was being undertaken to try and find out who was being served by which organisation, but I'm probably not the best person to respond to that. And finally, for the public feedback, I think most organisations that have continued working through the crisis have been doing their own analysis. So I know we've surveyed we have responses from over 600 of our clients. So I think that county can actually just ask local organisations to submit that rather than reinventing the wheel and doing that again.
Thank you very much. Thank you. Any other comments from contributors at this stage? If not, I will go over to Jeff. Jeff, your question, please. Sorry, Michelle, did you want to come in there quickly? You're muted.
Michelle, you're mute.
That's better. You're on mute, but we can hear you now.
There wasn't, in terms of data sharing, there was a group that was meeting regularly. We did get to the point of being able to share some of our lists, because obviously there's all sorts of legal frameworks that need to be taken into consideration, and I'm really pleased we managed to start our way down that process. I think we probably could do with bottoming out a little bit so that we're ready for whenever something else like this happens. But we certainly both received lists from organisations so that we would either agree not to call theirs or they would know that they were being called. And we also gave our lists to various different people. So I don't think it's a problem to have more than one call in a kind of 2 or 3 month period. I don't think that's terrible, but I certainly think it helps be coordinated to get in touch with people who are falling through that.
Thank you very much. Over to you, Jeff. Sorry, thanks for your patience.
Yeah, thanks, David. Excellent presentations. They really are. Very, very impressed. I've just made a couple of notes here. I mean, a positive message that I'm certainly getting, I'm sure other members are, is the partnership working. How well that's gone. That really is impressive. And probably the negative message I'm hearing is the digital exclusion issue. Not sure how that's addressed, but that's something I'm sure we can consider. But in terms of questions, seems a while back now, I think it was from Michelle. I've made a note about food parcel returns for the shielded residents. I did have an issue myself where I've had a couple of phone calls. Thinking back on it, it was probably early in the lockdown, where residents they'd received the food parcel, very grateful for it, but didn't actually need it and would have preferred to return it, and they were unsure where to go. So maybe that was a comms issue there that was addressed later, but be interested to hear about that. And with Simon, he talked about the volunteers, about checks that were made for these volunteers. I just wondered what those checks were, and were there any sort of obstacles in those checks that maybe need improvement? Be interesting to hear his comment on that. Thank you.
Who's going to step up to start to deal with that one for us?
Chairman, I could just respond on the question of food parcels that have gone astray, if that would be helpful. So I don't know if members will recall, but at the time that we were operating the Herts Food Parcel Scheme, the government also had a national food parcel scheme in operation too. And there was, on occasions, though, and it was often, in fact, probably 90% of the time, it was the national scheme food parcels that were turning up. And I suppose they didn't have as much local intel about who they were delivering to. And so quite often we were contacted to say, we found a food parcel, and we knew which ones were ours because they had a leaflet in there, suggesting how people might want to tap into sources of advice and support. So, we could always track down our ones. So when we heard about, when we got tip-offs, if you like, that national ones were being delivered, our job was to try and sort of, get in contact with those people and see if we could help them if we could track them down. We often found that we were getting calls from people who wanted to cancel their food parcels nationally, but didn't know how to do that because the process of doing that meant going on a website, and often people aren't, potentially older people may not have been comfortable with that. So we would help those people to do that cancellation process. I think that was probably why we did have some of these food parcels that had gone astray. Chairman, I think the rest of the question was addressed at Simon, I think, wasn't it?
It was indeed. Thank you, Helen. Simon, are you there?
Yeah, I'm here, Chairman. I had some connectivity issues again. Perhaps Jeff could summarise that part for me, and I'll answer.
Yeah, it was just regarding the volunteers. You were talking about that there were certain checks were made, probably for all volunteers. I just wondered what those checks were, and were there any obstacles that you found in making these checks, and maybe some improvements to be made there?
Sure, yeah. We checked all volunteers at different levels depending upon the roles that they were taking, as is the requirement with DBS checking. So essentially every volunteer was spoken to, their identity was checked, they were then interviewed for suitability by the team. And there were some challenges with that because 6,000 volunteers coming through the various centres is equivalent to about 3 years' work, and we had roughly the same number of staff members there. So depending upon which volunteer centre it was, that it was either done by bringing more staff into the volunteer centre. Certainly that's what we did, by deploying people who would be working on different projects that were mothballed at the time, or in other volunteer centres they use volunteers to do that checking. We were then able to do DBS checking for those volunteers that were doing regulated activities. The only drawback with that was the time that took. And so by building with HCF a programme of training for volunteers, we were able to put them in a holding position whereby they would volunteer. They then got a response which says, while we're doing all the checks and finding you a role, here are some training things that you can do about induction and safety and so on. So it wasn't a big issue. The biggest issue I think that we encountered with that was where local and national organisations outside of our control were recruiting volunteers from within Hertfordshire, but without those stringent checks. And there were a number of examples. There was one, for example, in Hemel Hempstead, where a volunteer had taken a gift from the person they'd been helping. We can trace that back to say it's definitely not somebody who went through our system. And we know that, but what we don't know is whether they were through a mutual aid group or NHS volunteering, for example. But the checks aren't necessarily there in the other areas, but I don't think they're out with our control. Does that answer your question, Jeff?
It does indeed. Thank you very much, Simon. Very interesting.
Yeah, Jeff, good questions, and Simon, good answers. And I think
you're frozen again, David. I think you'll come back to us very quickly.
Yes, I'm here. I'm back in the room. Yeah, sorry. So just to recap very quickly, how to effectively and most importantly accurately and quickly assess volunteers. Firstly, for safety and other factors, but also for making sure we use their skills and put them in the right job. So that's something to capture. Tina, I thank you for your patience. Over to you.
I'm just thinking along the lines of learning that people have made, because you've all had an absolutely wonderful response to everything, and I thank you very much. But do you think that in the pipeline there might be a need to have an emergency plan for the volunteer sectors? Because I don't know whether that has ever been thought about. And as there was so much information that was being sent out, I wonder if there's any means that could be actually pre-seed before it was sent out, so that the various groups who have a very limited number of people didn't have to spend so much time on actually paper reading than on doing the actual work that was their forefront of things to do. I don't know if anybody could comment on that for me, please.
Simon, you're probably best suited at this stage, aren't you? You've had the most experience on it.
I'm happy to comment on that. Thank you, Tina. I think there is a real benefit to us taking the learning from this first crisis, really, and putting that into a plan so that we could, should we need to mobilise at some point in the future, have an off-the-shelf plan that all of the CEOs from the key charities across Hertfordshire can draw off their shelf and start working. And that would give us a real running start, I think, to addressing the next issue. It would have to be flexible enough and agile enough that it could cope with any number of scenarios, but it just take us through the bits so we don't lose the learning that we've had. So things like the formation of Operation Sustain, we all know it's there, we know we're going to get called on, we can start working on the contributions we may have to that. Would be really positive. And then Tina, your second part was about summarising communications, and I would totally agree that there was lots of stuff that's coming out, not only from the county but also from districts and from central government, and keeping up with that was almost impossible given the amount of reading that there was to do and the amount of background things that we had to do. So in order to deliver these services, you had to ignore the reading. And I think for most CEOs, myself included, we ended up working 7 days a week and working 15 to 18 hours in a day for at least the first month or so. And that was a little unfair. And I think it's also true, and in fact I know it's true of Christy and the team back at Herts County Council and of Helen. So I'm not trying to say we're special in any way, but I think if we could find a way to make it easier, simpler, and have a lot of that bit pre-agreed, we could save the mental health and well-being of those people delivering it. That was my point.
Simon, very, very cogent answer. Thank you. Tina, does that cover your point? You're content with it?
Absolutely, thank you.
Thank you. It brings to mind, and it's a good thing, but keeping some keeping this sort of effort going will undoubtedly need resource and expense, and perhaps the government might be mindful of that and assist us. It brings to mind that in former times we had things like the civil defence organisations which, you know, could step up to these sort of things, be they civil or pandemic, very, very quickly. And we need perhaps to get back to something like that on some scale. So thank you. I've got Nigel just wants to come in quickly with another question to Sarah, and then I'm going to draw this session to a close. Nigel.
Yeah, I think Helen's offered to answer it. Not quite sure what she means by formally, but
yeah,
it was really just picking up Sarah's comment in the report, or no, in her verbal report, that there were, you know, there were gaps that, or she was concerned that there were gaps that weren't being fully identified. And so the question really to everybody is to how we're going to move forward and try to pick those up in future.
Okay, thank you. I'm looking around now, just make sure there's no final questions to sweep up. If there isn't, I'm going to formally thank our contributors.
David, could I just intervene here? That it would be helpful if Helen is able to respond formally to that question around the gaps in the service and for completeness, if that's feasible, Chairman.
I'm happy to do that very briefly, Chairman. So I suppose part of our work is to make sure we keep these networks open, that we keep the lines of communication open, that we are listening really hard to groups and getting that intel through. So we're having, you know, conversations with all our co-production boards where we really get a very rich picture of where people are struggling, what the themes are, what the issues are. And as soon as we identify a theme, you know, I can assure panel that we go back, we think about what we can do, around our response. And I suppose also around that, we did try to do quite a bit of work in phase 1, which I think we will need to revisit in phase 2, about data sharing. We had lots of different sources of data. We collected data from district councils about people they thought were potentially vulnerable people. We had our own database within adult care services. VCS organisations shared some of that data, and we had a data warehouse where we were able to, data crunch all that and sift through it, and then use that to direct our reach out processes, our call outs. So I think, there's an awful lot of data there, an awful lot of people. The important thing for us is how we use that information intelligently and insightfully to target our work. And I think that's the challenge probably that we still need to work hard on. Thank you, Natalie, Chairman.
Thank you very much, Helen. And that draws us to a close at the end of this session, and my thanks to everybody, contributors, attendees and members, for your work on this particular session. I'm now going to call for a 10-minute break, so would you please return at 12:20. 12:20 please, where we'll go into the next session. Please shut off your microphones and Welcome back, everybody. It's 12:20. I'm just waiting for confirmation from officers that the feed has gone live again, and then we can.
We are live again.
We are now live. Thank you very much. That's good to know. Welcome back, everybody, to this next session. I hope that break was effective for you. Just to give you a warning, I'm prepared to risk your wrath and eat into the lunch period if necessary in order to give this next session the appropriate amount of time. But in doing so, can I welcome Andrew Hadfield-Ames, Head of Communications, together with Nuala Milbourne from the NHS and Tom Byrne from Welwyn Hatfield District Council. Welcome, all three of you. I'll leave it to you to sort out who is going to lead and going to make your presentation to us. Thank you very much.
Thank you, Chair, and I hope it is appropriate for me to bring along a slightly wider cast list of supporting comms folk, but there is a simple reason for wanting to do so, that although it was my name on the list of participants, I feel very proud about sharing this platform with a number of my comms colleagues from across the partnership, and Tom, who will probably come in towards the latter part of this presentation for doing some sterling work on the real focused work on younger people, but also Nuala has been giving a really useful and constructive viewpoint from the NHS and East and North Herts CCG. I would also probably say that another colleague, Fiona Winspear from the Herts Police, has also been a key lead role in the SCG. Without further ado, I was going to just spend possibly 5 or 6 moments just going through our overall approach, some of the governance, but really just trying to highlight 3 or 4 key examples that are referenced in the Word document that's been sent to you beforehand, but also hopefully just pick up a couple of specific areas which I know that you members were interested in hearing a bit more about. Focus on young people, which I've just mentioned, but also some of the vulnerable groups that my ears were burning in the earlier and fascinating discussion that you've already had this morning. So first of all, just wanted to very much say that we have been working in a partnership way. I think we've always had strong links with the various partnerships, but I think this pandemic has really brought to the fore some of those working relationships. So every Wednesday morning we have a weekly comms cell which Tom chairs. Across all of the health, police, includes representatives from the district councils, but they have a separate meeting. I very much feel that I play a lead role, obviously representing the public health angle of the pandemic, but it is very much a shared workload where we all contribute and have really constructive discussions and bring various different expertise. I will just allow Nuala or Tom to keep chipping in at various points, but I would also just progress at pace because I do want to leave a lot of time for questions. So casting our minds back to the early part of March, I think I'm right in saying that Hertfordshire was really at the forefront of dealing with the initial cases. I think it was one of the first cases, but follow up very quickly. I was sort of responsible for that, some of that initial response. I think it's fair to say that initially it was a media reputation role on some of those individual infections, but also working very closely with the schools, even at that point, to try and get safety messages through their systems. It also came to light very quickly that we needed to not just work with staff, but also at the very highest level of our stakeholders. And actually, some of the processes that we set up with member services within the first weeks of this pandemic have continued throughout, but have been flexed up and stood down depending on the need. One of our first campaigns was really focused on one of the single things, or the most effective things, that the residents could do, hand washing. It was a really proud moment in that my team really worked at pace, working with partners from across the different organisations, and this became a bit of a model that we learned from and iterated in following sessions, but really turning things around in hours rather than perhaps weeks in our normal time frame. We did use public sector authority figures to really bolster the campaign, and it was a successful campaign with almost half residents saying that they'd seen hand washing immediately after the launch. So I'm just going to stop this presentation because this is actually the previous version of this slide deck, so you'll just have to apologise for me 1 second. But what I do want to say in relation to the next point is the fact that we have continued to change our messaging, continue to update and learn from those initial marketing messages. And actually, we've seen throughout the pandemic how we have evolved some of those messages. So for a number of you who will be familiar with the play your part messaging, then you will also be aware of the change of messaging, the 4 key issues from not just focusing on hand washing, but also to focus on key issues like face coverings, social distancing, and crucially testing and self-isolation. In the Word document, you may have noticed that we did evolve that campaign to really focus on or split those 2 messages so that we could very much focus on not just testing, but also on the self-isolation message, and I'll focus on that in 1 second.
Andrew, if it's okay, I'll just come in there while you're bringing up the deck.
Thank you.
Just to say that the way we were working, as Andrew points out, it was very much flexible and reacting, as well as taking a proactive approach to a very emerging situation, and we would set up, making use of the resources and the expertise that we had around the county within the different agencies. We'd set up working groups to look at specific areas, themes or campaigns that would then go away, divide out the work and report back into the cell. And apologies, yes, I will turn on my camera when speaking in the future. Thank you.
Sorry about this. It's not picking up the correct slideshow, so I'll just have to continue without the images. But I will just push on. One of the other key focus that I wanted to mention is about how we've really focused from a geographical perspective through the local outbreaks. I'm sure a number of you will have seen some of the targeted activity. You'll remember that Hartsmere was identified as an area of concern. We did huge amounts of work in that locality, and actually this has now become a template model for recent activities in other areas, which now our district communications team have been following through. I'm going to bring in Tom in this point, because we did have an issue within both Hertsmere and Dacorum about young people. We were able to target a number of them through social media adverts, but in addition to that, we felt that we needed to really focus on them as a distinct group, and we did a really interesting campaign that Tom's just going to briefly talk about.
Over to you, Tom. Welcome.
Thank you. Thank you, Chair. Yeah, I get to come on and talk about dancing grandmothers, which is a first for me, really, in this sort of setting.
First for us too. But
so the as Andrew says, the data told us what some of the issues were around the outbreaks that we'd seen in Hertsmere and Dacorum, particularly. And we knew that some focus work was needed on a particular age group, sort of 16 to 25s. The key really was gaining insight into those audiences, sort of understanding their behaviours, and so that we could understand how we could change them. And focus group work told us that they weren't listening to the government messaging necessarily, and in some cases felt unfairly targeted by it. There was also some confusion around the messaging of why schools were okay, but meeting the same friends later on wasn't. They were less worried about the impacts of coronavirus on them personally, and even those with good intentions slipped back into old habits, especially with sort of peer pressure applied. So with that in mind, we used an innovative approach, using the voice of local grandmothers to deliver our messages. The LRF and its partner organisations were not seen to be involved, at least initially. Videos were created by Hertfordshire Nans, one initial video, which was the launch of the so-called Nantervention, and we referred to her as Nan Zero. This was Margaret, and she was fantastic, and she did a TikTok video, which was aimed really at that key audience, absolutely communicating the messages that we were consistent with the Play Your Part messaging, but obviously in a very different way. There was really strong partnership buy-in and approach to the delivery, including when the LRF officially backed the campaign. And stepped in and started sharing that content very widely. We reached 58,000 people in the target audience in 1 week. A subsequent survey indicated that about 60% of people in that age group recognised the contents of the campaign. And a sort of secondary wave of press coverage and broadcast coverage gave us a lot of additional opportunities to get that messaging across, and that included on broadcast media, radio, and as well as ITV News London. And it was also an approach that was widely recognised by comms peers across the country as a really innovative and successful way of targeting that age group, which is notoriously difficult to get engaged.
Thank you, Tom. And in addition to some of the focused activities that Tom's just alluded to for younger demographics, we were also asked about what activity we've done around vulnerable groups, and some of that is around focusing on diverse communities. I've already mentioned Hertsmere, where there's a significant Jewish population, but we've done a range of different activities. We've tried to make sure that all of our campaign materials are reflect the diversity in Hertfordshire. We've also celebrated and tried to address certain religious festivals, but also we've really tried very hard using a range of people to create videos in specific communities' own languages, as well as Jim McManus holding a number of webinars with community leaders, and really trying to also focus on specific communities who have been most affected by COVID, such as Pakistani and Indian communities in specific geographical areas within Hertfordshire. Obviously, just over the past week or since Saturday evening, we are still, looking at implementing the government stay-at-home messaging. We're already planning the next version of Play Your Part, which, as I've previously referenced, we'll be learning from the previous iterations. We will be using real Hertfordshire case studies. We think that will come across well and better than actually authority figures this time round, so people in the homes or at the school gates. And we'll also need to be thinking very carefully about how much outdoor advertising we can do if people are meant to be staying at home, and possibly focusing those at around the school gates or at essential shops. Hopefully, as some of this approach has shown, that we've continued to do some of the market research that some of your earlier witnesses have been demonstrating. We've also actively used that within our communications approach. So you can see at the bottom right, we've actively used some of the survey results in some of our self-isolation communications, and we're actively already planning for what happens next after the end of these current national restrictions. I'd just like to pause there and welcome any questions. I don't know if Nuala just wanted to say anything before we open up to questions about that partnership approach, or perhaps she can come in on some of the questions. But thank you, members, for inviting us and hearing from us.
I'm happy to come in, Andrew, if that's okay. I was just going to say what a difficult line that everybody has been treading throughout this pandemic with regard to public messaging, and how important it's been that we've had this partnership approach with really regular meetings and joint approaches. We've had to tread a very fine line between making sure people are aware of and concerned about the virus, but ensuring that they're not dissuaded from attending hospital appointments, contacting their GPs because they're over fearful about the virus. So we've been balancing our messaging very carefully, and it's been really important to make sure all of the public sector organisations have been on the same page with that. We've also had to react to changing situations in Hertfordshire around things like the availability of testing appointments. For example, at one stage it was very difficult. A few weeks ago, you'll be aware, to get a COVID-19 test. So then we had to really flex our local communications to give people practical advice about what to do if you couldn't get a test and what should you do next, and to help people differentiate parents who are concerned about children going back to school, picking up back to school sniffles. What was the difference between a COVID symptom and then a normal September going back to school cold? So we did some very specific communications targeted at parents around that, because we were concerned that children might unnecessarily miss school and parents might be unnecessarily concerned. So we responded to queries with that with Q&As, which were led by local GP leaders. And then thirdly, just to say that we're going to, one of the things that we've really noticed is that adherence to self-isolation is a concern nationally, and also a concern for us in Hertfordshire. And what we're trying to do locally is to ensure that people have the information that they need to support them through their self-isolation. So an upcoming project is to ensure that when people leave, before people leave the COVID-19 testing centres, they're given information and a leaflet which not only sort of reiterates the importance of them self-isolating, but gives them practical tips and advice about what to do if they're going to struggle to get by without help. And the Hearts Help service is incredibly important for that. So we'll give people a real genuine source of help and advice if they would struggle to go home and stay at home and not go out for a fortnight, which for a lot of people, for financial, for practical, for emotional, all sorts of reasons, is incredibly tough. So I think without this partnership approach, we'd have struggled to get some of those messages across.
Thank you, Nuala.
Thank you very much, everybody, for your contributions. That's super. It's evoked a lot of interest from members, and they're going to ask their questions in the following order. Nigel, followed by Lynn, with then Jeff, and then Tina. So, Nigel, over to you, please.
Thanks very much, David, and thank you, Andrew, Tom, and Nuala. Top of my list, I think, is the message about asymptomatic transmission. My feeling is that hasn't got through to people as much as it needs to, and therefore that's behind a lot of the reluctance to comply, because people just don't realise that even if they're not showing symptoms, that they could be a danger to other people. Are we addressing that with our communications? And secondly, on the young people question, and well done, Tom, and everybody. I think the intervention is a fantastic thing. When was that run, and is it still being run, is my question on that. And then the questions that came up earlier about non-digital communications, what are we doing there, and how are we addressing digital exclusion? That's all from me.
Do you want me to take the asymptomatic transmission? Okay, I mean, that's really interesting and a good point, Nigel, and it's something that we face every year with the flu, but we've become used to not worrying about the flu. But there's an awful lot of asymptomatic transmission of the flu every year. People don't realise that they can have it and pass it on to others who are maybe more vulnerable without being aware. I think what we do have with COVID is the fact that if you have been exposed to somebody who is known to have COVID, then either on your app or in the communications that you get from Test and Trace, you are told the importance of self-isolating because you could pass the virus on to somebody else. So people are given that reminder. How seriously everybody takes that reminder, or how able people feel to comply with that, is a real issue. So I think I think surveys have shown that most people do intend to comply when they are told to self-isolate, have a good intention to comply, but then life gets in the way, which is why we're looking in Hertfordshire to do more about giving people the practical support they need to comply. But yes, I mean, some of the upcoming campaigns that we are working on in the ComCell at the moment talk about the risk of what you could be passing on without realising. And I know Tom's been very involved in that. What does self-isolation mean? And we've developed some resources specifically around that. So don't just pop out to the shops. Don't just go and visit a mate, because even though you feel perfectly well, you might be giving, one of the examples, you might be giving COVID to somebody for Christmas. So yes, I think that is a concern. It's a very misunderstood concern. We know, even some, people who should be well informed about viruses don't realise that if they're not physically themselves coughing and sniffling, they still might be posing a risk to others. So I think that's a really good point. And it's something that hopefully the upcoming campaign, which I know you've been pushing ahead with, Tom, is looking to address.
Yeah, that's right. I mean, it's sort of running in duality with the information about, the importance of self-isolation and exactly what it means, and the length of time for the various different reasons you're asked to self-isolate. But yeah, it's a bit more of a hard-hitting kind of visually approach, which really is just trying to connect exactly with the behaviours that came out of the survey work. which Andrew alluded to earlier, which identified some of the behaviours that the reasons people were saying they would break their self-isolation, and actually tackling those head on and saying, well, it means that you can't just pop to the shops and so on, or take the dog for a walk or go for a run. So it's again, it's evidence-based. And running in tandem with the information that Nuala's described.
Thanks. And if I could just pick up the final question, but also to say that the Nantervention campaign has either finished or almost finished.
No, it's finished now.
But what we hopefully got across during this presentation is that we're constantly iterating and evolving. So, we'll be looking to capture the lessons learned from that specific campaign, if and when, and I'm sure we'll come up again where we really want to target that group of people again. We might not have a dancing Margaret ever again, but there may be similar lessons learned about how we can do that. In terms of the non-digital comms, I have done a bit of research sort of across a couple of points. So one is that there has been no so we have taken, broadly speaking, a digital first approach, but when we've been getting the research data back in terms of our informed ratings, which have broadly been around the 60 to 65% throughout the different marketing research, across the age spectrums, which you might think could be a concern for those who are not as digitally active, actually the informed levels are consistent across the age groups. We have also taken different opportunities to really try to focus on different groups. So you've already heard around the county-wide leaflet that we're looking to replicate again over the next few weeks, focused on some of those key issues around Hearts Help. We have, of course, worked very closely with Kirsty and Helen around VPAC and really targeting some of that information, whether that's with direct physical correspondence, but also we've done a lot of outdoor advertising and also something called boots on the ground in localities to make sure that we're not just sitting back on our laurels and focusing solely on social media and digital channels, although we can see very well how our marketing materials are being reached and are working through those metrics, particularly where we use advertising spend. But thank you for that question.
If I could come back briefly, Chair, just on that. The non-digital comms, I think one of the suggestions from the voluntary sector was that they could be used more to deliver those messaging, particularly Hills. I think we're saying this. Obviously, they're in and out of people's homes all the time, and that's a resource that we could do well to make use of. Yeah,
good point. Nuala.
Just on that specific point, we've produced a winter health booklet, which is specifically aimed at people who are a clinician would describe as moderately to very frail, so that those are people who generally tend to be in their homes. We produced 10,000 of them. They cover COVID as well as winter health and wellbeing, nutrition, sources of advice, financial support, the importance of getting help. Those are physical A5 booklets, 16-page booklets, and we're really delighted that Hills have agreed to deliver 3,000 of them for free with their Meals on Wheels over the next month or so. So that's been a really fantastic partnership for us. The other 7,000 that we've printed so far will go out through social prescribers based in GP surgeries, through other community and voluntary organisations. Our Hertfordshire Fire and Rescue are also helping to give those out too. So we really are concerned that we don't exclude anybody, and there is something about the fact that if you have a physical resource which is in your hand with that handy phone number on, that's something you can put aside for when you really need it. And we know for lots of people it's a really useful source of help and advice. That's a really targeted piece of physical communications which we are putting in directly into the hands of people that need it most.
Thank you, Neil. And just two additional points, Chair, before we move on. One is we have, during the first parts and the sort of the middle of the lockdown, really focused some of our posters and leaflets at some of those areas which you would normally associate, or people for the older age groups would visit. Yes, working very closely with Neil and colleagues around GP surgeries, also libraries. But I do think, Nigel, it's a good point. We can always do more, and I am very pleased to note that we will be having a person from the voluntary sector on our comms cell, I think possibly even from next week. So I think it's a really good point. Thank you.
Good. Thank you, everybody.
Yes, thank you, everybody. Most helpful. Thanks for your contributions. Now, I'm going to call Lynn, Jeff and Tina to ask their questions. But could I just point out that it's 10 to 1, and I want to draw a line under this session at 1 o'clock so that we get away for a 30-minute break. So if you colleagues, if you could bear that in mind as you proceed with your questions. So over to Lynn, please.
Thank you, Chair. I've got a few points. I'll make it brief. Just wanted to thank you all, but particularly Tom, because I obviously do read your weekly briefing. First bit, thank you for doing TikTok. I know that came out of something I chaired locally. What worries me and why I prefer the written word is for those of us who've been doing this brilliant thing about don't go out if you're told to self-isolate. But unfortunately, once you put it on some of these platforms like Facebook, you get the conspiracy theorists come in, which really doesn't always help. So sometimes having the written word put through the door actually stops people reading what they perhaps want to read. I'm glad you appeared on ITV London. I just wanted to comment that trouble with our county, half of it is split into the east and half of it is split into London. So I wondered if there's anything specifically produced for what I call the school gates, because I've had some governors say they're really having problems with parents actually gathering at the school gates. And finally, for all of you, you've spoken about lots of things, but have you actually worked with Heart's vision loss? Because I think we've got a lot of people whose sight is particularly bad and perhaps won't pick off the screen or even won't pick off leaflets, whereas they do have a newsletter that goes out, and I wonder if that's somewhere that you could work, and that's another group of people that could be brought in. Thank you.
Thank you very much. Who will pick up on that? Andrew? You're muted, Andrew.
Apologies, Chair. Very happy to take that final point as an action. I know that we've got a person within my team who's very, well versed on inclusion things, but I'm very happy to take that as a specific action. We've been doing huge amounts of work with Tanya Rawle and Simon Newlands within our school team. Probably twice weekly comms, going through the head teachers. Sometimes directly text messaging to parents. And I do think that our next wave of banners and posters will, one key part of those possibly will be the banners at the school gates you're referring to. So absolutely. And, we are throughout this whole pandemic trying to take a proactive approach with our media. We're having now fortnightly briefings with the local printed press, but also we're constantly looking at ways in which we can get that regional TV coverage. Hopefully some of you won't be too disturbed with Jim McManus on the 6 and 10 o'clock news last night, just re-emphasising the central government messages. But we can always do more of that kind of press activity. Thank you. And sorry, just on the point about the conspiracy types of things, we do see a lot of polemic views on social media around some of the deniers and some of the people who are almost too fearful. We will always look at direct marketing to try and combat that, but we also do try and apply that 80-20 rule about picking up new issues and also trying to respond to things through things like myth busting articles, which do seem to really work. Thank you, Chair.
Thank you very much. Jeff, over to you.
Yeah, thanks, Chairman. I will be brief because I think probably touched on some of mine. Just to mention my opinion, the comms scheme. I thought it was a very good scheme. I really did. I thought the message got across very well. I know you issued posters and leaflets to us as members, and I did use those locally within my division. And I just think the use of the purple and the chevron, I think that was that theme was very successful. Dancing grandmother, thought that's brilliant, absolutely brilliant. Didn't quite go viral, but it was working towards it, wasn't it? So yeah, perhaps if that was repeated again as a theme, that could be useful. But in terms of a question, I was wondering about, is there a specific demographic that you feel that you failed to communicate with in the campaign? Obviously, digital exclusion probably comes in here. Nuala, you mentioned about the A5 booklet just now. I think that's very useful because that's targeted at probably the area I'm thinking of. Demographic, the elderly.
Jeff, I'm sorry to stop you there, mate. You've asked the question as I see it, and we're very short on time. So,
beg your pardon.
Yeah, officers have picked up on the question. Can we? And
just the second question, while I've got it, was in the report in 2.3, where you're talking about lessons learnt from wave 1 that have been applied in the second wave. Perhaps just expand on that. Thank you.
Thank you very much. Who's going to pick up on that?
I'll try and lead, and then very happy for you, Tom, to correct me or amplify. So I think, first of all, thank you for, there is a real role for members, and, we will definitely be wanting to get some further posters and leaflets in your hands for the next refresh. The calming purple was very much advised by the behavioural change unit, and, we have had some really positive feedback. I don't think we have got any evidence that we have failed or not communicated to any specific demographic because of the evidence that I've just provided around the consistency around the informed group. And with the local outbreak plan, the approach has been to really focus on specific localities, high-risk settings, and age groups where there is an increased rate of infection. And that's primarily why we really targeted the young persons campaign. Do we have more to do in some of those more vulnerable groups? We probably do need to acknowledge a degree of emphasis on the digital channels, which I think Nigel has got some points to. I think the work that Nuala has been doing is fantastic, but we are also constantly trying to move with the different infections and really trying to target specific groups at specific times, so that's been our approach. I don't think we have identified any specific groups, but there's also always more work to be done, and I know Nuala's team is also working on newer videos in communities, specific community languages. And we do know that there are higher risk groups currently around the Watford area, particularly the Indian and Pakistani communities. So we will be going off and looking at how do we target information for them possibly over the next few weeks. Tom, did you want to build on that at all?
No, I think you've captured everything I was going to say, Andrew. Thanks.
Thank you very much, colleagues.
Just
Gina,
about the second wave, about the lessons learnt for the second wave. Any comment on that?
Nuala, quickly, if you will.
I think one of the things that in the first wave, there was a general fear. It's almost a sort of a stranger danger fear about COVID. People you could see were very concerned about catching COVID when they're in a queue for the shops, when they're reaching for something in the supermarket, when they are out and about walking down the street, and you see people physically shying away from each other. I think if there's anything I'd like us to really try to tackle and do it in a very careful way and not in a scaremongering way, is the fact that actually you're much more at risk from catching COVID from your grandchildren, from your best mate who you've gone outside for a cigarette with, from people you know and trust, because they're the people that you get the closest to physically, and therefore they're the people you're more likely to spend the time with indoors, and they're the people that you let your guard down for because it's your grandchildren, because it's your best mate, because they don't look poorly, you know, we underestimate the prevalence of asymptomatic transmission. So if I would say it was really about thinking about maybe not missing a demographic, but missing a message that actually it's those people that you are physically and emotionally closest to, where you have to be really careful. We don't want people to be terrified, and we don't want people to feel isolated, but we want to help to encourage people to communicate and get support in different ways so that they don't put themselves at unnecessary risk.
That's a very good point. Thank you very much.
Thank you to everybody. Tina.
It's just a comment I'd like to make that you've mentioned GP surgeries. People are having great difficulty in getting into GP surgeries to collect anything. The libraries are now closed as well, so people won't be getting to the libraries. And I do have a very strong concern that the domiciliary organisations, the people who go into care in people's own homes, are not getting the information that they ought to have. And I certainly think that the A5 booklet ought to go to those organisations so that they can go to the people who are isolated in their own homes and are increasingly worried about the prospect of never leaving their house after a year. So they're just comments that I'd like to make, but I'd like them made fairly strongly. Thank you.
I mean, it's Nuala here. I think that the idea of giving those leaflets to domiciliary care associations is a really good one, and we'd like to take that forward. 10,000 booklets was based on the number of people, Nigel, that are known to be frail, but we could look to do more of those if we think they're going to be useful. So yes, we can look to give those booklets out in that way, Tina, and I can speak to county council colleagues about the best way of doing that and the safest way of doing that. And with regard to GP appointments, yes, it is very different, and people are triaged first or have an online consultation first, but there are still face-to-face appointments available if people need them. And that's the message that we're going to do some comms this week across Hertfordshire and into West Essex on that very theme, because we know that some people are not coming to see their GP and are not getting those appointments because they are concerned. And we want to make the point that, as opposed to the first lockdown, when lots of services stopped, lots of essential services are pushing through, and we want people to be aware of that and to continue to turn up for their appointments.
Can I just add that it wasn't the fact that they're not getting the appointments, they're not going to the surgery because they're being triaged, so they can't pick anything up from the surgery. They can't pick up a leaflet up. So it's just a comment.
Yeah, that's absolutely the case. We've got a budget to do proactive social media, so we are paying for things to appear on people's timelines. And we know that lots of older people are active on Facebook, for example, and we're asking people to make sure messages get to their elderly relatives who might not have them too. So we're trying to do what we can in lots of ways, through texting out through GP surgeries as well, which we can do. It's expensive, but we've used that a couple of times to remind people to come in for their appointments. So we can ask GPs to text everybody on their patient list if there's very urgent messages, if we have further concerns. But I think that their point's well made, and they show why it's difficult to communicate at the moment, because lots of things we'd normally rely on just aren't there. So we're having to be innovative and call on lots of support from our partners in community and voluntary organisations too.
Thank you.
Thank you very much. Thank you, Nuala. Thank you, Andrew. Thank you, Tom. On that question of distributing to more vulnerable, there's always the option, perhaps, of bringing pharmacies into it, because pharmacies will, without going into the details of GDPR, they will be aware of people who collect either directly or indirectly prescriptions who are in those groups, and it may well be that we can bring pharmacies in. But I'll just leave that as a thought. As we close now, apologies to everybody. We've eaten severely into the lunch break, but I'm sure you'll forgive me. We will break now for lunch and return, please, promptly at 1:30, where Natalie will
Chairman, just to confirm, we're live again now.
Thank you very much, Fiona. Hello, everybody. Welcome back to this now the afternoon session of the COVID Step Back Review topic group. We'll start the session this afternoon with a brief précis from Natalie, Head of Scrutiny, as to the work that we have undertaken this morning. Natalie, over to you.
Good afternoon, members. I will try and keep this brief, but you had quite a lot of information provided in the agenda pack, and now I think you were able to extract quite a lot of information during the morning's deliberation. So I will try and keep it brief, David, because I know how much you've got to run through this afternoon, but I will try and do justice to the evidence that was given, particularly for those witnesses who are joining us this afternoon, so they've got a context of what members are looking to build on. So just really to start at the beginning, there were some questions around how well prepared the authority was, and you heard from ACS officers that in the lead up to lockdown there'd been a sense from early in the new year, particularly from February onwards, that things were getting quite serious, and therefore this would have an impact on services, so that there was a lot of pre-planning taking place, and a February seminar thinking about how to address various scenarios, which clearly then fed into how the government's response to announcing lockdown was taken. And you heard that Helen Maynooth volunteered on the Wednesday, and then the Thursday following that, the government message came out about lockdown, and 5 days later they were distributing food. So obviously the pre-planning had fed into that enormously. And you also heard from one of your witnesses from the community and voluntary sector in terms of that there was early mobilisation that they felt well supported around, and that they had their first meeting on the 12th of March, which was pre-lockdown, and then that took place in person, and thereafter virtual meetings continued weekly. So I think members were able to get some assurance that the authority was not caught on the back foot around some of the challenges that they then had to deal with. I think it's fair to say that all of the witnesses talked about the existing partnerships and how they were able to expedite those to build on and take services forward in a joined up and county-wide way, and that the early decision to use Hearts Help as a gateway kept it simple and straightforward, enabling both residents and community and voluntary sector groups, along with others, to have there was that first port of call that would help get people to the information and the services that they needed. In terms of the community and voluntary sector, I'm not going to pick out specific organisations because I think there was quite a lot of crossover with what was said. They were talking about the importance of keeping in touch with one another, that HCC was responsive to their requests for changes of services or how funding could be accessed to give them infrastructure and building in capacity, that commissioners were flexible in allowing the service providers to use their professional judgment in terms of how services could be best delivered to their specific user groups. That you heard from a couple of the community and voluntary sector that actually one of their big advantages was having a skilled cohort of paid staff who were able to utilise the volunteers very, very effectively, and they expressed concerns about the resilience of the demand that was being placed on those paid staff in terms of keeping the services running and bringing new volunteers on and bringing them up to speed as quickly as they possibly could. You then challenged around the legacy of how this could be maintained, some of the good practice that you were hearing about. And so you heard from both officers of adult care services and from voluntary sector colleagues around that many of those meetings are being maintained, not as regularly, but that contact continues, and actually that's been helpful in terms of mobilising services even more quickly for the second lockdown. And the strength of the process, you heard, was the regularity of the meetings, the information flow, and that was a two-way channel, so that concerns were being passed up and down to ensure that decisions were made at pace, but also based on good quality information. In terms of CVS more particularly, there was a clear indication from that group that actually in coming together and working non-competitively allowed them to develop very collaborative solutions and work in tandem rather than trying to compete for funding or services. And that is something that they were mentioning as something they would like to retain. And again, you heard from ACS officers about how they are seeking to put in place measures to facilitate that. And I think that that may well be one of your recommendations, that you have some sort of exaltation, but with some sort of timeline around how that legacy is maintained and developed going forward. Obviously, digital was an issue, not just for older age groups, but some of those groups that don't have access to the tech, be that broadband or the kit through which to receive it. And you had some indication of how that's being taken forward in terms of some of the community and voluntary sector receiving grants to start undertaking digital learning in rural areas, and how that might be addressed further. You also got the advantage of the community and voluntary sector being able to work in that more collaborative way, that they were able to provide good peer support to one another. And I think that's not to be underestimated. You heard how hard people were working in the voluntary sector, both paid and volunteers, and that some of the chief execs and senior officers of those voluntary organisations were being asked to make decisions which gave them real angst. Closing down services which they knew were the lifeline, literally, for some of our most vulnerable groups, and the way that they then tried to work around solutions to ensure that those people were continued to be supported through the pandemic lockdown and beyond that. A gap was identified in terms of working with the NHS, that there is some work perhaps to be done in terms of the NHS fully understanding the ability of the voluntary sector to step up and support various groups. So again, that may be something that you wish to return to as a recommendation going forward. You heard from voluntary sector that they did quite a lot of learning from the first lockdown, which has informed the future plan and immediate mobilisation. And then moving on to the comms, which was a slightly shorter session, but you still got lots of, I thought, really useful information and a lot of your questions answered. You heard that the approach was a geographic focus, alongside a county-wide initiative looking at specific groups in an attempt to ensure that there was coverage across the county, but not neglecting some of those key groups. And you heard how community members were being directly used to get some of that messaging out there. You heard about the TikTok Nans video, which I haven't yet seen, so I must try and find TikTok and get sight of that. But also how using real people in real situations was something that Andrew Hadfield Amis talked about, in terms of really making those messages resonant, that it's not just the leaders in the community, it's actual real people that can make a real impact on the way that people behave. In terms of lessons learned for comms, you were informed that upcoming campaigns will focus on social isolation and how COVID can be passed asymptomatic, and that actually there's a fine line to be drawn between making sure those messages are powerful, heard and complied with, but also not instilling fear in the population. So that it's a kind of a balancing act in terms of how those messages are delivered, so that people are comfortable with them and are able to live live within them. You heard of various ways that different groups being communicated with. You heard what sounded like a really useful booklet for some of the most vulnerable groups that Hills is distributing along with other groups, and that the comms cell, not just HCC comms, but the comms cell for the LRF is looking to maintain a proactive approach, because they obviously see that as something that's proven very effective to date. Obviously, members, they are seeing you as crucial in making sure some of those key messages are clearly delivered to communities that can actually do some of the myth busting that Andrew was talking about, and also being very clear about how at-risk groups can be supported and the support that is available for them. And at that point, David, I was going to conclude.
Thank you very much, Natalie. Bang to time. I've got an echo in my headset, so forgive me if it sounds a bit strange. Yeah, spot on to time. Colleagues, we're going to move now again to a situation where we're going to look at partnership working with other organisations, but get it from a slightly different standpoint. So that should be interesting. But before we enter the session, could I just implore colleagues, where possible, the timing we have for questions is naturally limited. Wherever possible, can you confine yourself to questions? Comments to build into a question are of course valuable and welcome, but if you could keep them to the most pertinent, that would be extremely helpful. So now I'm going to invite Linda Hazy, leader of East Herts Council and now the chair of the COVID chair of the Community Reassurance Cell, as part of the local resistance forum, to join us and present to us. Linda, a very good afternoon to you. Welcome. Thank you for coming to see us today. Over to you.
Thank you very much, and thank you for your time, colleagues. Can I just skip through the first 2 or 3 slides, because I think it put my presentation into context, but I believe, in fact, you've seen most of this. So on to the next one, please. And the next one. Right, so as David has said, I'm the chair of the Community Reassurance Cell, and so far nobody's been able to come up with anything slightly more witty than the CRC. The Community Reassurance Cell is part of the Local Reassurance Forum, and it was set up at the end of March, but is very much a part and parcel of what the LRF is doing. It consists at the moment of leaders from these boroughs and districts, with Tim Hutchins sitting on it as a representative from County Council. Next slide, please. The fact that David Williams and I are photographed twice in next door and in alcoholic beverages systems, one is a wine store and one is McMullen's, is totally coincidental. But one of the first jobs we were doing was doing this comms area to say it's safe to go out shopping, and then subsequently the opening of hostelries and restaurants. Next slide, please. One of the other projects that we've been deeply involved with is Travel with Confidence. It became apparent when we started to look at the data that a lot of our taxi drivers do come from the BAME community. And as you well know, they are a sector which is at higher risk than other areas. So we have set up with some money from Jim McManus, thank you very much, to actually train taxi drivers on how to be safe, how to stay safe, and how to keep their passengers safe. Last week I was photographed with the first taxi driver in East Herts, which was awarded this. They are allowed to use it as promotion. They get the money back they get £100 back for the screens that they will have purchased. And we are very much wanting people to look at, is this taxi driver trained to do this? The scheme is covered across Hertfordshire. We're talking with the LGA about it, and also the East of England. So I think this is something which actually really has substantial benefits to our residents and also to one of our working populations. Next slide, please. We ran a whole we worked with Play Your Part. Next slide, please. And we were very deeply involved in what all these comms were going to and what they were saying. Now, when the first CRC was set up, it is looking across all 10 districts and boroughs, and we sent out a form to community impact, looking at the community impact assessment questionnaire to over 400 charities, helping groups, individuals, and saying to them, what are the things that you are most concerned about within your community? And we were looking at it from a short-term point of view, a 6-month point of view, and going right the way forward. And I think, as the last week has demonstrated, the CRC will actually have a role to play in our communities for the coming 12 to 18 months. So I'm very grateful to Alex James and Mel Donnelly in their teams for doing all the analysis, for bringing it all back. Next slide, please. We had 120 responses, and we asked them to look at these 8 areas. And from that, next slide, please, we were able to identify those themes that were causing most concern amongst those groups. And those groups actually varied. We asked the Lord Lieutenant to fill out a form, health groups, mental health groups, carers, and scouts, anything and anybody, faith groups that were working with their communities at the time. So these were the recurring themes that came out. We also put in some economic questions because we did work also with the economic recovery cell. Next slide, please. So what we are working on now is hearing from witnesses and holding webinars. Now, we will come on to it, but the first webinar we ran was for the BEAM community, which was some 4 weeks ago now, where we asked certain leaders within that community to come and present to an audience of about 140 on the webinar, and this was on a Friday evening, to explain what they were doing and what we can all do to make this particular segment of the population feel safe, because this is one of our most vulnerable areas. We worked also with a reference group, so everyone we contacted is by definition a member of our reference group. Next slide, please. And this is part of the timetable that we have been drawing up. So we meet, to begin with, we met once a week, then once a fortnight, and now that we have a more established programme of going forward, we will start meeting just once a month, but there's an awful lot of work that's going on. So I believe you heard from Sarah earlier this morning. She came and presented to us on Monday, and a lot of what she said was very concerning, and we will be taking some of those matters forward. Next slide, please. So we did pick BAME as a priority, and you can, next slide, please. And this is a picture of the webinar that we ran. Next slide, please. Gosh, 9th of October. God, it seems a long time ago now. We will now be running, but I think what have we learnt? We've learnt, and I'm sure you've heard, just how extraordinary our population is. 10,000 volunteers coming forward to volunteer to help with our community. As far as I can tell, there is only one equivalent CRC in England, and that's in Suffolk, and that is actually led totally by officers. There are no member involvements with that at all, sitting on the guiding group. I spoke to them a couple of weeks ago because I wanted to hear what they were doing and compare it with what we were doing and see what we could share in terms of learning. And it became very apparent very early on that, in fact, their population is very different up there. So there were vast areas where there was no community resilience, no community base whatsoever. And it was council officers who had to go in and do all the organising. And they mentioned, obviously, on the coastal areas of Lowestoft and Yarmouth. But certainly in this, we are very proud, and we should be very pleased that we have such an amazing population that's come forward. And the next one, please. That's it. OK, I think I'd like to thank our officers, the officers that have worked with me on this, both in the county and across the districts. They've been extraordinary. We are going to run webinars coming forward, and I've been in contact with Alex James this morning. We will be running one which is on loneliness and isolation for older people, which came out of our work with the Age UK and Hills this week. And we will be running a reference group webinar as well, so that all 400 organisations, if they wish to join us, we can then update them as to what we are doing. To begin with, when we started this, if I'm honest, I wasn't quite sure where we were going to go, where we'd end up. But actually, it is all coming together now. And I think one of our jobs in the CRC is to make sure that everybody else knows what everybody else is doing. Because we worked out very early on that a lot of what we were doing was already being done by youth services, social services, etc. But what we needed to do was pick out some of the bigger topics from those areas to make sure that they could be covered across the board. So thank you.
Thank you very much, Linda. A very comprehensive presentation. And thank you for making it available earlier. And it's a comfort to me to know what I'd long felt, that we do have still a community, a strong community spirit here in Hertfordshire.
David, you seem to be mute or frozen. I can't quite work out.
I think he's frozen again. He's back with us. Back in the room, David?
I am here. I don't know if you can hear me. I'm certainly part of the meeting, but you may not be able to see and hear me.
Yeah, got you now.
Nigel. Okay, good. Nigel, yes, please. Would you start the ball rolling, please?
Yes, thank you, David. Sorry, yes, you froze there, probably as you were asking me to start. Okay, Linda, thanks ever so much, and congratulations on the work you're doing. I know it's very much appreciated, and the webinars I've attended, the BAME one was very, very useful indeed. You mentioned emergency planning as being part of the role of the Resilience Forum, and we heard earlier today from the voluntary sector that there didn't seem to be an emergency plan before all of this that involved them. Not sure if that was at all or enough, and that one of the things that they were suggesting, I think, or at least I took from the discussion, was that we ought to be rethinking our emergency planning in the future based on the experience we've had over the last year. Would you like to comment on that?
Can I comment on that? This was my very first contact with the LRF, so I don't think I could comment whether or not there was an adequate or sufficient emergency plan in place. I think I had my interview with Daryl, who said, Linda, this is a command and control. You ask the questions up the line and I give you the answers down the line. So I thought, right, okay, that's got me sorted, wasn't it? But we're a bit more flexible now, so don't worry, I go around the edges. And certainly one of the things that we talked about on at the meeting we had this week was, given what had happened at the weekend, how does that change what we're going to have to do in the next 6 months? And I think one thing that has come out is very much the isolation, the loneliness, not just of older people, but of all of us in a way, and that mental health aspect of it. And I think I think that is a real concern. It's the mental health, because we're all very, very isolated now, and sometimes it is very, very difficult. So I think I've seen the work that Owen Mapley has sent round to all the staff. In East Herts, we do questionnaires for staff, we do questionnaires for members. So that's slightly answering your question in a roundabout way, but I think it is all part and parcel of learning what we could have done better as an organisations, but which we have to make sure we really do better in the next couple of weeks and probably going forward.
Thank you. If I could just ask one other question, the community impact assessments, you said you had 120 responses. How representative do you think that is of the community as a whole?
It was pretty comprehensive. I mean, perhaps what we can do is once we've had our webinar with the reference group, we can send those forms out again. We did a lot of social media. We worked on community leaders doing the community leading bit and filling out the forms. I don't think there was any major gaps, actually. Looking at the replies that came back, we covered pretty much all bases. But you can never ask too many questions too often.
Indeed.
And everyone will say, well, I didn't know that was going on. So I think that's one of the things that we will be reassessing, is whether or not we need to go back out again. But then you don't want to get people filling out forms all the time when they actually all should be going out doing stuff. If you don't know what the answers are, you can't get them to go out and do stuff.
Yeah, very, very fair point. Jeff, over to you.
Thanks.
Yeah, thanks, David. Good afternoon, Linda.
Good afternoon, sir.
Good to see you, but we can't actually see you, which is such a shame. But anyway. I
can see me in the corner of my screen.
Okay, that's fine. No, thanks for that presentation. No, very, very good to see the work of the CRC. You touched on the mental health issue there just now. That I think that is a very important issue that has just come to the fore now that we're coming on for a year down the line with this dreadful issue. But you touched on the taxi driver scheme, which brilliant initiative that is, and that seems to be going well in East Herts. Is there a proposal to spread that out even further in terms of offering it to other transport areas? I'm thinking possibly community transport, which is a key area obviously a lot of them aren't running during COVID, but it's something where it would be good to have them COVID safe, COVID secure.
Yeah, no, you're absolutely right. This working with community bus drivers is very, very key. At the moment, we've got an email. I've sent an email out to all of the 10 boroughs and districts, or the 9 other boroughs and districts, to say what sort of numbers are we talking about. So I'm working with the licensing officer at East Herts so that we can come up with something which is appropriate for community bus drivers.
Brilliant. Thank you very much.
Is it all right for me to come in now, Chair? Linda, can I just ask you just 2 questions, really? One is when you showed us the slides, there were 4 district councils or borough councils and Herts County Council. Can you explain why the other 6 aren't on that list? Perhaps I missed that, but just for clarity. And just to say what Jeff said, one of the groups we rely on, and I'm sure other areas do, but certainly in Welling Hatfield, are these CVS volunteer drivers. So if you do some training for others, that would be a really good one. But I'd just like to know why the other district councils aren't on that list. Thank you very much.
It's not that they're not on the list, they're on a different list. So the Herts leaders meet once a week. At the moment, it's once a fortnight since the beginning of March. And the CRC was decided that the CRC would be a smaller group of leaders who volunteered, who said we want to be involved with this, but everything is always fed back to all the leaders so that they all know what's going on.
Thank you very much, Linda. Excuse me. I've got no other questions so far. I'll just go around the circuit again. Just check with Tina quickly before I offer it out. Tina, do you have any questions at this stage?
The question was to do with the taxi drivers, and that's been answered. Thank you.
Excellent. Okay, thank you. Okay, I offer it up. Anybody else want to come in at this stage? We have a few minutes spare. If not, I think it's down to the fact we had an excellent presentation, beautifully explained. And
David,
Jeff.
Yeah, I just wondered, as we've got time, I don't know if Linda can add any further. That's interesting comparison to Suffolk, I think she mentioned. Anything further to add on there? I mean, how we compared? I know that obviously very difficult, different areas, but anything we could learn by what they've done?
No, to be quite honest, I think we were being we were pretty good.
They've probably learnt by us, Linda, haven't they?
We do our best. Hertfordshire tries to always lead. We will keep in touch. I mean, I suppose one thing I did learn from them was they'd done an amazing project with things called Grand Pads. So they are very simple iPads, but called Grand Pads, which the county council with districts and boroughs have bought about 100, which they lend out to residents who maybe not have kit or may not feel comfortable using a fairly complex iPad, and they're taught how to use them, and they have been phenomenally successful. So this is something which I am talking with Chris Badger about, and also we've talked with Age UK about as well, because I think sometimes older people in particular feel nervous about using technology, but if they know they can't actually delete everything off a screen, which you'll have trouble with sometimes, I think this is something that's really, really interesting to actually go for. So that was one of the big projects I learned that they had actually got in place, and it was working very well. And people who said, "Oh, I'm never going to touch a bit of equipment," actually were hooked on it. And then as soon as they became hooked on it, they wanted to upgrade their equipment, so they bought themselves an iPad, and the Grand Pad went back into circulation.
Linda, that was going to be my question. What happens to the pads when the people of that generation upgrade? Because I've had exactly that experience in my family, where when the initial resistance was overcome, they took to it like a duck to water. And that suggests that the equipment comes back into circulation. So that's wonderful. A question from me, Linda, is more of a comment, but there's an element of question to it. Maintaining this partnership, even potentially post-COVID, because clearly valuable lessons. One of the strands that we're coming out with today is capturing the value that we've achieved during these exercises to make sure that we can tap into it quickly. Any thoughts on that?
Well, I think I've said right from the beginning of when we first started in March that the CRC itself will probably run for another 18 months, if not longer than that. It will evolve. We're very different now to what we were when we first started in March. And we just have to be flexible enough to make sure that we're able to respond or put people together, a bit like a dating agency, for making sure we solve problems, because the problems of our residents will change. And we just have to make sure that we're there. But I think one of the things that is so good is that the leaders and all of us work very closely together. And in that sense, we want to achieve the best for our residents across the board. So, yeah, I see us carrying on. You make a good friend on Zoom or Teams and you don't lose them, do you?
No, indeed. OK, well done. We've got a little bit of time, and I know Nigel wants to come back in. Nigel, you put your hand up, but I can't see that under present circumstances. So if you can stick to chat
as well.
Come on in. Yes, we can accommodate that. We have the time.
Excellent. Yeah, no, I'm really just to comment on what Jeff had asked and Linda had answered about the Grand Pads. I remember on one of the other webinars I was on during the summer, I think this was being, can't remember which one it was now, there have been so many, but it was being stressed by somebody, I think possibly in the context of schools, that the technology you need is actually quite simple in order to keep in touch and really pushing that message out is worthwhile. And if we're looking at purchasing IT equipment to help, then simple is best, and keep the cost down and maximise the reach, I think was the message. I did have one other comment, and that was I was actually just surprised that it was only Suffolk and ourselves who had something like this, and whether we'd done much to promote this model more widely across the country.
Not at the moment, we haven't, but I think we certainly can. There may be others, but when we started this in March and when I followed up again a few weeks ago, the Suffolk and us were the only people we could find. But I'm sure other people are doing it in a different way.
Ways. Yeah.
I think in terms of the technology, there's on these grand pads, there's quite a lot of really cute YouTube films because they are American, of lots of grandchildren showing their granny how they are making cakes, and it's all being done through GrandPads. So if you get bored for a few minutes, look up GrandPads on YouTube.
Excellent, thank you for that. Jeff, you just want to come in quickly and close the session for us?
Yes, thanks. Yeah, as we've got time, Linda, we had a question on resources regarding district councils, and I just thought, with your district council leaders hat on rather than your CRC hat on at the moment, perhaps you could help me with answering a question. It's regarding I remember that there was an issue initially with the government resource that was passed down to districts for funding towards grant funding towards businesses and organisations, etc. And there was initially a delay in that funding getting out to its rightful place. And I think that was eventually resolved because it all sort of went quiet on it. So I just wondered, were you aware of that, and how was that resolved?
Are you talking particularly about East Herts or any other units?
It probably happened elsewhere, but I know East Herts did get a mention.
We certainly did. In fact, I had a phone call from the minister. I was put on the naughty step. So thank you for reminding me of that aspect of my life, Jeff. I think the thing is, what we have all found is that the government puts out notices probably on a Friday night with no clarification as to what or how it's going to work. You then get the clarification on the Tuesday morning, and you're expected to implement it on Thursday.
Yeah.
So I think when this first tranche of grant money came out, I know that a lot of, particularly in areas where there are a lot of SMEs, there were hundreds of businesses who were eligible to claim that in fact nobody knew existed.
Right.
And so I think there was a very, and obviously officers don't want to get caught up in fraud by just dishing money out. And there was a worry that districts would have to pay it back, but we had the assurance from the minister that that would not happen. Well, and so I think we then had to say, well, look, let's do the best we can. Everybody will be in the same boat, and we know that there's been fraud. And I think that was one of the problems. But I think this tranches of grants that are now coming through, the databases are a lot better.
Good, thank you very much.
I know a number of us were tramping the streets trying to find addresses of businesses as to whether they existed or not.
So it was basically resolved by updating the databases then, really?
It was resolved by taking a more pragmatic risk management, plus making sure that the databases were as accurate as possible.
Yeah, great.
But that's not, as I understand it, Jeff, that's not a criticism of the databases that the rating authorities hold. It's simply a question that a lot of these businesses are not on the rating system because they're not eligible or they don't qualify. So that's why they get missed out. Yeah.
Yeah. Okay. Absolutely, David.
Good. Excellent. Thank you very much. A very interesting session. Linda, many thanks for joining us. You're more than welcome to stay. virtually or electronically or whatever, but I know you're busy, so we will not feel at all aggrieved if you leave us at this stage. But we're now going to go into a session with you. Thank you. Thank you very much for your contribution. Members, we're now going to go to stage with Jim, but I'm not sure that Jim is quite ready yet. I'm waiting for confirmation if he's in the room, but at the moment I rather suspect it isn't. So it's a little bit out of sync. Can I ask officers? Jim has flagged up. Jim, you are here.
Yes, sorry.
I used your name in vain. I do apologise. The right ear was saying you weren't, and the left ear was saying you might be. Once you've counted the vote in Georgia.
I was lurking quietly in the background.
Lurking, yes. Doesn't that surprise me? Okay, there you are. Larger than life. Okay, over to you.
Okay, so I'll try and be as brief as I can because I'm conscious members will have questions, and I think my focus on this is what have we done, what have we learned, and how has it contributed to the questions that scrutiny have asked. So if I'm not answering this, Chair, if you just interrupt me.
Okay, happily.
And eventually my screen will share. So can members see this on the screen? And forgive the fact it's not in County Council livery, it's in a sort of generic Health Protection Board livery. I just want to talk you through very quickly the where I think our approach has led us to as a partnership of agencies, where the public health work has taken us to. Earlier on this week, we agreed that we would develop an approach called 4 weeks to win 6 months, which is using the current 4-week restriction periods to set the scene for the next 6 months. And I think this is an example of everything that members will be asking. We use a thing in all our health protection work in public health called the cycle of health protection, which we helped develop and is now in national guidance. And it starts off with surveillance and epidemiology, moves to evidence, moves to formulate actions, and then moves to implementation, and then on to evaluation and iteration. And that's a deliberate attempt to take a quality approach to kind of health protection work, which obviously COVID response is. We distilled that locally into 4 questions, and each of them has sub-questions which we use on a daily basis. So what is driving infections? What works in tackling this? What resources are needed, and who will lead? And in fact, that's driven a whole load of our quality work, from the modelling work to the data work to all sorts of other things. And when I look back, actually, we've done quite a lot of what I would call quality learning. So in terms of successful and innovative approaches, programme management approaches have been key. We've set great store by programme management in public health, and if we didn't have it, we would not have been able to respond in the speed with which we have in this pandemic. In fact, we deployed programme managers into every cell of the SCG, including the recovery group, including the excess deaths cell, including PPE cell and vulnerable people's cell. There was a public health fielded programme managers to every piece of work. We have an internal weekly battle rhythm meeting, which was twice weekly and is now weekly. We also developed an account management approach, so there would be a dedicated public health link for each cell. So, for example, in the care home cell, they were the people who spent quite a lot of time giving technical public health advice. And we deployed resource quite quickly, switching off non-essentials. So our core demand on the initial tranche of 20 million that came for the County Council for COVID response was only £225,000, because we took the deliberate approach that we would do what we had planned to do, which was switch main resources to pandemic response. And that's why we had such a small spend against the initial tranche of funding. Obviously now with outbreak funding, we've got much larger spends dedicated to COVID. We put a lot of work into data modelling and systems, and I think we took an overarching systems approach to everything, especially the local outbreak plan. So we would take a team of teams approach, if you like, to doing things. And our behavioural science approach has been copied nationally, as has our communications. In terms of instilling trust, well, we funded significant communications work. We were the first local authority in the country to set up a schools help desk and helpline. We set up a web hub, as well as a range of other information. And we funded capacity for the local pharmaceutical committee from Public Health to communicate with pharmacists and communicate with patients during the first peak. In terms of working in partnership, again, I think our multi-agency health protection board. So we went from when government asked us to create an outbreak plan and stand up both an elected member board and an officer board in a month, we did it. We had it published within the month, which I think is a testimony to all of the agencies working together. And the SCG, I think, in Hertfordshire, the Strategic Coordinating Group, massively underpins that partnership approach. We set up a public mental health cell. We've got multi-agency approaches to every aspect of work. Even where people have fallen through the cracks, so where I've had to personally intervene to enable testing for, very vulnerable people awaiting cancer treatment, or do compassionate interventions with people caught in the system, that I think is a testimony of the relationships enable people to ring one another, to ring each other, and to address a problem in confidence and get it done quickly. So I think relationships have been the glue through all of this thing with our organisations, and without those, I don't think we'd have been able to move as quickly. And I think the work done by Comms has been amazing for us. It's been a key aspect of our response. So in terms of looking forward, I think this kind of approach we've developed of programme management, the cycle of health protection and take equality and systems approach means that we have daily surveillance meetings, which are multi-agency, to look at what the epidemic's doing. And we also have foresight meetings, which is, where is this epidemic going and what do we need to do? And that, I think, led us to these strategic choices. So we think there are 4 strategic choices to Easter next year. 2 are unacceptable. First is lockdown until there's a vaccine. Well, that's just unacceptable. The second is let it run uncontrolled, often known as the herd immunity strategy, which is a complete misuse of the science of herd immunity, which is an equal worst option, because the disease burden would be 120,000 people worst case scenario with ongoing severe symptoms that needed NHS care. So that's 20 GP practices, a new general hospital and 100 psychologists, none of which we've got. I think the other thing to say is what we want to avoid is simmering, where we exit measures, we don't have optimal performance of all the systems, self-isolation is poor, and the numbers eventually rise and we go back into lockdown again. So our preferred option is we use these 4 weeks to suppress the virus and exit with measures that will keep it suppressed. So we use the lockdown period to get as much as possible working optimally. Nobody has a perfect blueprint for this. This is not an exact science, but our modelling work suggests this is the best way. And so our priorities for the next few weeks are prepare for the next 6 months, get the strategy in terms of compliance, review all our existing priority plans, be ready to roll out mass testing when it comes, ramp up contact tracing. So on Tuesday, we spent a further £934,000 for district capacity on contact tracing. We also will have a new shared computer programme for contact tracing, which will go live on the 1st of December across all agencies. We will design and implement a new end-to-end pathway to support people to self-isolate. So from the minute you get handed a leaflet at a testing site, right through to making sure that you've got the payment if you're eligible for it, making sure that you are able to self-isolate, and we will ramp up kind of compliance measures in places where infection is highest. I won't go through the programme plan headlines, but I will just touch on the fact that this has also raised new areas of work for us taking this quality approach. We have decided we want to do more work on business and hospitality accreditation, which is good to go, and obviously the end-to-end pathway I've just spoken about. And if I can leave that screen for a second, and in conclusion, in just a minute, show one more screen, which is the surveillance dashboard, which I think has been one of the great success stories of our joint working to date. Because actually, although information is not perfect, we have far more levels of information than many other people, if my screen ever decides to share. If I can share this screen with members, if it will share, which it seems to be deciding it doesn't want to, the surveillance dashboard that we have, which is largely used for operational management of the outbreaks, which it doesn't seem to want to share. We can now tell common exposures, and from the data we have, the highest level of exposures that people have to the virus. So, for example, in Hertfordshire, what we now know is that a significant number of people seem to be being infected by shopping situations and supermarkets, from what they are telling us from contact tracing. And that approach to improving the data has enabled us to factor that into our epidemic response. This Microsoft Teams doesn't seem to want me to share it, Chair, so I'll stop there. And if it lets me share it at some point during the questions, I'll put it up if I may.
Yeah, that's fine, Jim. Yeah, Microsoft Teams is not working very well for us today, but thank you so much for that. I'm looking to topic group members. Was that you, Nigel? You're normally, as I say, you're normally fairly early in the yeah, first out the trap. You've got number one on your back. Right, go for it.
Both early and often.
Yes, quite.
Yeah, thanks very much, Jim. Some very interesting observations there. And I guess the one I want to pick up on is on the messaging, but also on some of the learnings which we then maybe need to message better. I must admit, from the start of this, the biggest question in my mind is, where is the virus transmitting most? Where are we most at risk? And interesting to hear you come up with the comment about shopping. But are we getting that message out to the community so that others are in the same state of knowledge about where is most dangerous? Because I do think that's important, again, for everybody to understand as much as possible about where the risk lies, and hopefully therefore be more compliant in those areas. And the other point on that is sorry, just answer that one, because I've lost the other one in my mind. Carry on.
Before you go on, I just want to make it clear, when you say where, you mean WHERE is most dangerous, not WARE, as in
I've heard various things about where, but no, that's not one of them.
Good. Go on, Jim. Away you go.
I would say there's probably three components to this. There's a component of having the data, and data has been a perennial challenge throughout this pandemic, I have to say. But we've got, I think, better data than a lot of, I think we've got better data analytics than a lot of other areas. Let me put it that way, by dint of partnership working. The second thing is what you then do with that data. And that is partly about the operational management of how you use the data for directed work. And then the second thing is what types of communications to who. So I genuinely, from what the survey that comms have done, simply telling people every week, you know, this is where the virus is spreading most this week, and putting out formal comms is not the thing that works, but actually doing two things. One is having regular press and media briefings, which we do, and use our press and media colleagues. And the second is tasking specific action on the ground in those scenarios where it's a problem, which we also do. So we have a daily surveillance meeting, and so when a particular situation comes up, which is the reason why within 24 hours we had boots on the ground in Hertsmere and in Dacorum and in Watford. It's also the reason why we did specific work around some BAME communities. We get things out there and get them out there fast. So for me, it's what you do with the information is not primarily about public communications. It is primarily about public health action. And that action may be everything from working with settings to make sure they comply, right through to public communications and everything in between, if that makes sense. So I don't think it's right to go out to the public with every single new development. I think it is right to look at every single new development and task somebody to do something about it, which is what we've been doing. Now, if you think we could do better on public comms, absolutely, we'll double down on that. But I think you have to, our view is we don't want our residents getting fatigue and confused messaging. So if it's shopping this week, but it's GP surgeries the next week, for argument's sake, I'm not saying GP surgeries are an issue. Actually, what we want them to do is to take the behaviours consistently rather than chop and change, because if you chop and change, you'll get complacency and people will just get tired.
No, I appreciate that, Jim. Thanks. The other things I've got on my list, which I've now found, were, and again, it's basically about communications with the public. And I do appreciate that the first step has to be what you do about it as public health. I do think personally that a little bit more explanation to the public on where the risk factors lie would be helpful too. But again, it's not something we obviously want to chop and change about. But the other thing that I mentioned earlier, when I don't think you were on the call, was the message about asymptomatic cases and asymptomatic transmission, which I still feel very few of the public actually get, or too few. And that obviously does affect behaviour a lot. I mean, that people aren't sufficiently cautious, even because they simply don't have symptoms. And I just think that's a key message that we do need to work harder at. And then the last one is the balance in care homes on advice between the desire to shield and the need to keep families in contact. I know that's been one that's been taxing your department and adult care, of course. So I was wondering if you might want to comment on that.
So I think on the asymptomatic issue, we know, and it is a constant battle to get the information out there that actually you may well be more infectious when you're asymptomatic than after you develop symptoms because your viral load is higher.
Yeah.
But the amount of misinformation, I mean, I get emails on a daily basis from people asking me to prove to them that the virus exists.
Yeah.
And my desire is to say, no, you prove to me it doesn't by means of references to peer-reviewed journals with impact factors of over 3.5, and then I'll engage it. But that's a challenge. So we will keep on with that. I think the second thing is, in terms of care homes, more guidance was issued on Thursday morning, and I think it is a fiendishly difficult balance to strike, to balance the right of people to a family life and to visits with the right of other people not to be infected. And you have two sets of rights that have to be respected, and then there's all other issues about liberty. we try to strike the balance right. I think we have an appeals process in Hertfordshire. We have new guidance. We are really keen when government gives us the testing capacity and the PPE to enable key visitors to be treated as such.
As key workers, yes.
But obviously that's only just been piloted in Manchester, somewhere, I think it's Greater Manchester, has been piloted. So we're very keen to do that, and we'll keep on it. But if I said to you that the care home cell alone keeps 1.5 of my consultants busy, full time, and part of my week, and all I can say is we'll keep going. I completely agree. We have to try and find a way of getting people to visit safely, but we also have to balance that with keeping people from a virus which for some people is deadly.
Yes.
No easy answers, I'm afraid, but we'll keep on it.
Okay. Thank you very much, Jim. Very helpful. Lynn, over to you.
Thank you. Can I just say, first of all, well done, Jim. I think you and your staff have been absolutely fantastic, and you'll probably be signing autographs after the last few weeks have been on the news. But just two bits, really. One is around local track and trace, and when we're talking about information, I think you mentioned elsewhere at panel or something, the percentage of the track and trace that you are managing locally compared to the percentage track and trace that you're managing nationally, that is being managed nationally. And perhaps that's something we haven't got out to the public. And can you tell us the difference in those percentages-ish? And my second bit, because it came up, I know with, or I believe with care homes, if you can confirm it, that agency workers are tested quite regularly. Something that I overheard, so I can't give sources, but was from somebody who may have been asymptomatic, a family member was positive, but they're a supply teacher and they don't have regular tests. And it just concerned me that we had supply teachers who were possibly going in asymptomatically and passing that on. And is there any way we can treat supply teachers in the same way we can treat agency workers in care homes? Thank you.
Well, thank you for those kind words. I think the Dean's cat got more time on than I did on that interview, but it is a very nice cat. To answer the care home issue, care home staff are tested every week as part of the national system, and that's really quite important in terms of making sure that every resident and every staff member is tested through the national portal. We have had challenges with that national portal, but hopefully they are getting progressively resolved. And that's because government's decided that it wants to prioritise that for care homes. It's not testing agency staff because teachers aren't currently tested every week. But if we get lateral flow testing rolled out in Hertfordshire, then the plan is that among the priority populations will be teachers for regular testing if they want it, and a number of other populations that I won't go into, so that we can actually target regular weekly testing to people either more at risk or more likely to spread the virus. So it's a national policy decision at the minute that we don't test agency teachers. I would say, though, that we still have the Hertfordshire key worker pathway, so that where people are symptomatic and they're a key worker in Hertfordshire, we can get them very, very rapidly tested. To then go on to the contact tracing question, national test and trace is still missing about 45% Or yes, Nigel, only symptomatic, because that's government's policy at the minute of if outside care settings, the national government policy is symptomatic unless we're investigating an outbreak in which we can test asymptomatic people. Lateral flow testing will enable us to move to asymptomatic as well as symptomatic, but we're not there yet. And you know, we're in the hands of what government can let us do because of capacity. In terms of contact tracing, so we've reached over 90% of people that we've taken over locally. Where we don't reach them, it's because actually we haven't been given contact details from them from the national system. The national system in the last 2 weeks was missing 40% of people and declining. And I think there are several reasons for that. So we have agreed with our PHE colleagues in the east of England that we will be having a workshop using value stream mapping, where we will map end to end the whole contact tracing process, so that we can so that we can sorry, I'm being our colleagues just messaged me, so that we can really improve things like the take up, the relationship, and a variety of other things in contact tracing. But that will take a wee while, and we are quite keen, provided we've got the logistics and the programme management support, to take on more of the contact tracing work. It is intensive. I think we are trying to work, we're working very well with region, and we're trying to work with national to improve things as we go along. Have I answered your questions, Lynn?
Yes,
sorry,
thank
we're quite
you.
involved.
Yes, thank you.
In that case, it's over to Jeff. Jeff, your question, please.
Yeah, I think you've probably covered my question, but I was going to comment on the strap line, Jim. I love this 4 weeks to win 6 months. I think this is a real good strap line. I think we should register that, or you should register that, most certainly. I'll certainly offer it to Boris. I think that would go down very well. And one assumes after the 6 months, what you're meaning, I'm hoping your meaning is that after 6 months we would have a vaccine in place. So yeah, just interesting to follow up on that, because my other questions was regarding care homes, which you've covered, and testing.
So I think your question is about how do we exit this pandemic?
Yes, indeed.
When nobody really has a blueprint anywhere in the world,
no.
and everybody seems to think they can do better than everybody else. So I think there's probably three things. I think one is I think we need a greater degree of humility from every scientist around this, because this isn't an exact science, but equally we have a lot of misinformation around. We have to do the following things to exit this pandemic. One is keep the virus down to a level where as much normality as possible can happen. That will only happen by a combination of measures, which I'll come back to. And the second thing is, as soon as we've got a vaccine, we have to roll it out. So until we've got the vaccine, the combination of measures is everybody needs to take responsibility for treating every other person they meet as infected. So that's the masks, the social distancing, the other stuff. This kind of combination prevention or Swiss cheese thing we talk about, you know,
yes.
A whole load of imperfect things all come together. The second thing is we need to progressively be able to kind of switch off restrictions and put them back on again. The third most important thing is everybody who's asked to self-isolate is able to self-isolate, because if you've got 1,000 infections and they all self-isolate, that's 1,100 at an R equals 1.1, or 1,500 people at an R equals 1.5 that won't get infected in addition. So the weapons of testing, tracing, self-isolation and hygiene have to be working at the very top of their game between now and Easter, because even if we got a vaccine let's say for argument's sake in February, it would take 2 to 3 months to roll that out to enough of the population to actually, for them to have then developed the immunity to curb it. So even if a vaccine arrived tomorrow, it would still take 2 to 3 months before we really saw the impact of that in curbing the epidemic with enough doses. Does that make sense?
It does indeed, yeah. Very wise words. Thanks very much, Jim.
Thank you, Jim. Well done. Excellent. Over to Tina. Tina, your floor's yours.
Thank you, Chair. I have a number of odd little things that are floating around in my mind at the moment. You've just mentioned vaccines, and it will take 2 months plus to get everybody vaccinated. But at the moment, we're finding that the flu injections are not being carried out because they've run out of the serum. So I wonder how that one would work. And I have a very strong concern about the domiciliary people who go into perhaps 12 houses every day, who A, weren't given the PPE at the beginning that they should have been given, and they are not getting testing. And I wonder how much that is affecting the people that they see, because they are very vulnerable, the people. If they're having 4 carers in during the course of a day, and those carers are each visiting 12 or more people, I just have that very serious concern, and I wonder where you feel about that.
So if I deal with the vaccine issue first, rolling out a vaccine is, I mean, I was involved in the 2009 post-Birmingham pandemic rollout of the first flu vaccine that was after the 2009 pandemic, and that was an interesting experience. So even after you get the vaccine, it will take up to 2 weeks to create immunity. That's if you're going to get immunity from it, but most people will. So this is such a huge exercise that our NHS cannot, my own opinion, this is a purely personal opinion, our NHS cannot do that on its own in addition to everything. It needs us all to work together. And one of the reasons we have a strategic coordinating group of the LRF under the leadership of Darryl Keane is that we can do that. So if I were in charge of national vaccine rollout, the first thing I'd be doing is making a beeline to local authorities and to local resilience fora because of the unparalleled logistic capability. And if I might say this, one of the things about the County Council is that we have very high logistics capability. You know, we just look at the way we've managed our facilities to put in testing. That was Scott's team. So I think there are capabilities that we can use. And I think you're right. I think the vaccine is too important for us all not to be in this together. I guess the second thing is in terms of domiciliary care. When we got PPE, and there is a PPE cell that is busy planning PPE for the next, for this wave and for the rest of the winter, we have rolled the PPE out to domiciliary care workers. We did, because government has not prioritised domiciliary care workers, our approach to PPE with them was to treat every person as if they could be potentially infected and write our guidance accordingly, so that we do everything we can with PPE to protect them. We do regular checks on PPE with domiciliary care staff. We would like to prioritise them for lateral flow testing when it becomes available. My own view is that if you look at the priority cohorts for vaccine, in addition to NHS frontline staff, domiciliary care staff and home care staff should be in the top category of priority. So I think we are doing everything we can to prevent and protect as things stand. The additional weaponry of testing and vaccines will be helpful. and we are actually stockpiling PPE to make sure social care doesn't run out of it.
Well, thank you for that. And I have to say, how have you managed to get 48 hours into every day when the rest of us only have 24?
He has divine guidance.
There's no answer to that.
Excellent, Jim. Thank you so much, colleagues. Thanks for your questions and taking that forward. That's amazing. Jim, as always, we learn so much from you. It's a pleasure to have you. Thank you so much for taking your very, very busy time out to join us today. Thank you for that. Members, as I flagged up on the screen, we're now at 2:45. That's 14:45. We're now going to go for a 5-minute, literally a 5-minute break, just get the circulation going, and we will resume at 10 to 15:50. Sorry, 14:50. So if you again. Welcome back, everybody. The live stream has been resumed, and so we will move on to the the next witness, which is Scott Cruddington. Are you there?
I am, Chair.
Scott, wonderful.
Hello there.
The floor is yours.
Thank you, Chair, and thank you, members. So just to sort of follow on from Jim's sort of structure that he's undertaken for his presentations for a few minutes is really for me to outline how the Resources Department has sort of really undertook its work during the course of the first phase of the pandemic, the lessons that we've sort of taken from that in the way that you know, the experiences that we've had, but also some of the great opportunities that we've had as well, and then really that's then fed into our planning for the challenges that we're now facing in a second lockdown and beyond. So I suppose that from a resources point of view, just to contextualise it, that we're as a department, we're made up of both back office and frontline staff services as well, like customer service centre, libraries, heritage services, for instance. But we also have those traditional support services that in most big organisations that you would likely to see, you know, legal services, human resources, IT and technology, property and finance, to name but a few. And we very much sort of took it upon us as our role, where we've got so many of our colleagues that were on the absolute sort of coalface of the response to the pandemic, and busily just needing to sort of pivot on the way that they were delivering their services, that our job in resources were primarily there to facilitate, support, coordinate and enable wherever we possibly could. And what that ended up resulting in, I would say, is from a resources perspective, that we ended up either directly or indirectly pretty much sending staff or resources to all four corners of the organisation. Some continue to run and operate from within the department under our traditional structures, but many were sent off to join other teams across the council and work in an embedded way, based on the priorities that they were working. And that was really because of the need for speed. We needed to be a lot more agile in the way that we worked. And again, there's some great lessons that we've learned in that sort of method of working. There may be some of the more traditional routes that we've currently used across the council in the past. And one of the other big challenges that we've needed to sort of pick up on was around this issue of making sure that everyone knew that we ultimately trusted them to make the right calls. In local government and the governance that we have across the council, that there's many checks and balances that we have in place. I would say that there is lots of opportunity for people to be able to work their decisions through a number of layers before ultimately it's enacted. But you know, during this period, we just didn't have the luxury of time to do all of that. So what this created was an opportunity for people to feel that level of sort of support and trust. We didn't always get it right. There were occasions where, you know, that things that we tried just didn't work. And we decided, you know, actually we make sure that we learn from those things, but then we sort of go again to try to solve the problem once again. So from our perspective, the big opportunities that we face, and I'll cover just some of them, that our relationships and networks that we'd built over many years really came to the fore here, whether that was working very closely with a number of our trading entities, such as Herts Business Services. You know, almost overnight, you've probably heard from other evidence given to you, we needed to convert effectively a school supplies logistics operation into a food distribution operation in supporting some of our most vulnerable residents across the county. From a LEP perspective, that we needed to deploy our skills and resources and funding and working with our district partners. And I think it was Jeff Jones that was mentioning earlier around making sure that we were getting funding out to districts, and then them being able to support our businesses to ensure that they didn't sort of hit financial problems, or certainly to get them across some of the more difficult periods of the first lockdown. We had great new relationships we built with the military in undertaking a number of our test centres that were set up across the county, and that's clearly going to be even more important as we move into probably a mass vaccination programme in the future as well. We created a redeployment hub where we had many services during the first lockdown. We had many services that ultimately had to shut and stop, a range of our registration services, births, deaths and marriages, our library service, and many others across the council that had to shut. Our HR team established a redeployment hub that at its peak had over 600 employees in it being redeployed to other parts of the council, really looking to match the skills they possessed to other parts and other tasks within the council. And we've undertaken sort of great lesson, a lot of lessons are being learned now for the second wave in how that redeployment hub will work, and I'll come on to that just in a moment. The communications, I think you've already heard from Andrew Hadfield-Ames earlier, so I won't go more into that. But again, the role of our communications, both internally as well as externally, to make sure our staff felt well informed about the policy decisions that we were taking, to make sure they felt safe and secure, and they knew the routes that they needed to escalate issues that they were finding, either from a personal perspective or from a working perspective. And we did all we could and will continue to do so to look after people through these difficult times. Our procurement changes, we needed to make some emergency changes to the way that we procured. Again, that was supported by some government legislation to allow us to be able to purchase, enter into contracts, extend contracts more readily. And I think our shared managed service contract with Serco that provide a wide range of support services in conjunction with the council, that was due to actually end around this period, and we were in the process of re-procuring a new contract. But with agreement of Serco, we've now extended that contract for a further 2 years to allow us all to have time to be able to deal with the current problems that are in front of us. Shaping Our Future is a new programme that's emerged out of all the lessons that we've learned through the first wave of the pandemic, and that is now starting to design a new operating model for the council going forward. So the best way of describing it in terms of the way that we were working pre the pandemic is not going to be that in the future. The way that we're currently working now, with so many people dispersed and very little opportunity to come together to collaborate, that won't be the model either, and it will almost certainly be somewhere in between those two sort of on that continuum going forwards. We helped establish Nightingale Courts within our Hertfordshire Development Centre that held over 316 sessions to be able to catch up on the backlog of court cases across the county. We supported the opening of 2 care homes that were there to be able to address the configuration that our adult care services needed to put in place to ensure people were protected in our care homes as people were leaving hospital, for instance. So I could go on. There are so many other examples about where the resources service has been sort of either facilitating or leading on the response to the pandemic. And just to conclude, in terms of the lessons now for lockdown, the current lockdown, I would put them almost into sort of 3 big areas that we're currently focusing on. The redeployment hub, and again, this sort of ability, we've got a high number of calls now being placed on that hub for resources to be able to help us now meet the challenges that we're now facing from effectively, yesterday onwards. But this time around, because so many services are still operating to some degree, that we've all learned how to sort of deliver our services in safer ways, and more digital platforms, and all the different ways that we can now deliver services. The number of staff that are now being redeployed are much greater, are much less than they were previously. So as a result of that, we are now having to think about whether we need to undertake a much more sort of significant reprioritisation of staff across the council based on the most essential tasks that we now need to consider. We need to gear ourselves up for the mass vaccination programme whenever that opportunity presents itself. That we're starting to see sort of examples around sort of mass testing of whole towns in Liverpool at the moment. And that again in partnership with the military to be able to do that. So whenever that time comes for us to be able to start thinking about vaccinating the population of Hertfordshire, I can rest assured that Hertfordshire County Council and resources within that will be critical to that delivery. And then finally is probably Operation Shield. I would say that the Operation Shield is, we're not expecting the same demands to be placed on our services in the way that we needed to provide food distribution services, but all of the infrastructure that that program set up previously in terms of dedicated supermarket slots, and support and care services and befriending services, volunteering. All of that infrastructure that was put in place is looking to now be stood up for this next phase. But our anticipation is we won't have a need to establish or re-establish food distribution on this occasion. So yes, so there's many examples. I think I'll pause there, Chair, and it's pretty easier if we go to questions. I'll do my best to answer them. Thank you,
Scott. Scott, many thanks. It's a truism, but I'll quote it anyway. It's a simple fact that your directorate is working in the background, but it's absolutely fundamental and vital, and none of the other activities can take place unless you and your team are functioning at the highest level. So thank you for that. We all acknowledge that. We all appreciate that. Nothing else goes on. All the good work that the other directorates and the other partners are performing is absolutely fundamental. Depends on your fundamental skill and performance. So thanks for that. It's a surprise to me, but Nigel's first on this occasion. Nigel, away you go.
Wasn't. I waited for Jeff. Jeff was first.
No, I don't think he was. He's not on my screen. He's not. Oh, yes, he is. Jeff, go on, get in there quick, mate. Go.
Shall I get in quick for a change?
I would, yes. Go for it. Yeah.
I'm fed up with being the runner-up. Scott, a great presentation, and fabulous to see the work that you're doing. Just some points there. Yeah, I mean, I was personally very pleased to see the two mini Nightingales, as I call them.
Yes.
Nevitz and Fourways, when they came on stream. To do that work in 4 weeks was absolutely phenomenal, I think. And I was pleased to say I was involved in it to a very small extent locally. But I mean, normally that would have probably taken 6 months at best, and probably more likely a year. But to do it in 4 weeks, absolutely fantastic. And of course, that they're there going forward. With the winter flu, etc.
Yeah.
So it's there for a long while. And you mentioned about working with the military on the testing program. That holds us in good stead for when hopefully very soon we have the COVID vaccination program. So one assumes possibly the military hold us out with that. But interesting to see, you mentioned in your report about working at pace did lead to additional costs. That is one of the problems. I don't know if you want to elaborate on that at all. Maybe that's one of the lessons learned.
Yes, no, absolutely. I think that sometimes when you're moving at pace, we are going to be expecting people to be working around the clock. There'll be enhanced hours. that are attached to sort of wages and salaries that we're paying for that period. But I think when you actually look at the true cost of delivery of projects, you know, some of those examples of the care homes that we opened, you know, the amount of sort of management oversight and time over a much longer protracted period, I think if we really did some detailed costings on this, we probably won't find there is much difference in the total cost of delivery when you consider the whole cost of time as well. So again, you know, we just haven't had the opportunity to do that sort of level of forensic detail at the moment. But I don't believe the premium that we were paying to get these things done was significant. And apologize, you know, again, I've heard, you know, councillors have heard so much about the money, and I always come on to these sort of things and depress people about the money, but I can always touch on that if councillors want to later on in the session. Thank you.
Yeah, thank you very much, Scott. Over to you, Nigel.
Thanks, Jeff. Right, so thanks very much, Scott. Very good and full report. Couple of things from it and from what you just said. You talked about a lot of learnings from the first wave. What's your mechanism for capturing those? Do we have a distinct methodology put in place? That's first question. Just quick question on the Nightingale courts. How effective has that been in catching up on the backlog? I know we've heard a lot from Children's Services and I think Adult Care as well about some of the impacts on from family courts particularly. We've got a lot of care children in care, or yes. CLAs currently as a result of that. And finally, just on the financial workings with ACS, I think Helen reported to Adult Care last week that we'd actually undone some of the changes that had been put in place previously in terms of the work, because I think finance have been kind of separated out and it's gone back into ACS. Just wondering if you'd like to comment on that as one of the learned lessons.
Okay. If I could, I'll take them in the order that you asked them. So in terms of how do we capture the lessons, so I'm fortunate that within my department that we have the corporate program management office that again always sort of sets out a clear number of standards about how we ensure that we undertake post-project reviews across the council. So particularly the best example I can give is that the officers, my officer Taryn Pearson Rose was heavily involved in the Operation Shield program, and off the back of that they did a thorough post-project review to ensure that all the right sort of almost that we put into a holding pattern for the next phase of the pandemic. So the lessons that were learned were put in place, ready to go, take off the shelf, open up again and make use of. So no, it's quite a routine sort of approach that we undertake to post-project reviews. They come to my resources management board where appropriate. We'll ensure that those lessons are captured and that there is owners of those lessons to pick up. As far as the courts are concerned, and I apologise, I don't know enough of the detail in relation to the decisions that the MOJ had taken, but the amount the feedback that we got from certainly the officers that we worked with our team at the Hertfordshire Development Centre was that they would have loved to have carried on, that there was, you know, that the setup was perfect for their needs, and there was a number of the backlog was starting to be got through, but I think as probably lockdown restrictions started to be lifted, etc., courts were starting to open, then the Ministry of Justice have obviously made their own operational decisions. So from it's
closed, has it now?
So yes, so those Nightingale courts have closed. The MOJ no longer makes use of our facilities. Up to now, we have more than enough capacity to make use of it if and when there is a need for it. But at this stage, and apologies, I don't know the detail about the decisions why MOJ have made those decisions. But all I can report is that if they asked us tomorrow, then at the moment we have more than enough capacity at the Hertfordshire Development Centre to be able to support that.
That's interesting, because the last report I saw was that the number of CLAs had leveled off. It was climbing quite rapidly during the early part of the year. It had leveled off, but it hadn't started going down again.
Okay.
So yeah, something for another day.
And then, and apologies, could you just elaborate a little bit in terms of the comment about the financials relating to adult care services that Helen mentioned?
Yeah, if I understood correctly, what she was telling ACS last week was that ICH was that the finance function had been moved out of adult care and had basically been moved back in again as a result of, I'm not sure if that was pre-COVID or whether it was as a result of COVID crisis.
Yeah. It's certainly the way that, because effectively the model that we have across the departments is that we have a core finance function within my department, and we also deliver through business partners. So we have a number of finance leads that work very much with the departments. They're embedded as they need to understand, with their management teams, so they really understand the business and and be able to then support them from a finance perspective. But we also then have finance leads within the departments that really understand the drivers behind cost changes and work on key projects, etc. And so they're employed by the departments. So the two come together and work almost hand in hand to be able to deliver all the the financial aspects of any day-to-day budget monitoring, all the way through to complex project delivery. So I'm not recognising necessarily the changes. So I apologise, I may be misunderstanding it, but that structure is still in place as it was during the pandemic, the first phase of the pandemic.
Okay.
Thank you. I think it's me next. Scott, I think one of the things, whenever I think of resources, I mean, not only is it money, it's people as well. Yes. And you mentioned HR. And certainly this morning, the voluntary sector, and as well as HCC and health, during all this, have had to employ more people, or as well as sort of redeploying, but employing new ones. So I just wondered, have they been employed on a temporary basis? Also, how has recruitment been affected? Yeah. And also, if they are on temporary contracts, obviously if permanent ones come up elsewhere, are we in danger of losing, or do we get them well trained and then suddenly there's no money to keep them on? So it's lots of bits around recruitment and maintaining that level so that we can keep the services going.
I would certainly sort of describe that what's happened over the first phase as we entered into lockdown was that there was a quite significant shift away from our level and exposure to temporary workers was reduced quite considerably during that period, where we were able to now undertake redeployment into roles that were previously being filled by temporary staff. So that sort of shift occurred over the first few months, and has very much sort of leveled off. What we're now finding, though, as we're starting to get really sort of see the sort of responses that we've needed to make, whole range of different issues, whether it be adapting high streets, whether it is preparing for the amount of test, track and trace resource that Jim's people need, through to the extra support staff that Chris Badger's team are going to need. The amount of recruitment activity has increased significantly. Now, the supply side, i.e., people within the that are looking for jobs that are well qualified and well skilled, what we're currently finding, because of the wider impact of what's happening in the economy, that we're almost over blessed with talent that we can now select from. But the biggest challenge is the throughput that our HR team are now having to concentrate on to be able to get everyone in recruited to really sift through sort of a high volume of applications that we're now receiving. Where before, we may have got 5, 6, 7 applications for a role. We're now seeing upwards of 30, 40, 50 applications for that same role. So, in a way, it presents a sort of a new challenge, because obviously we have a duty to review all of those applications to see whether they meet the criteria of the role before we decide who to shortlist an interview. So from our point of view, there's going to be, we will always have a mixed economy of permanent staff and temporary staff. For instance, again, another example is if we move into vaccinations, there'll be a need for people to be able to inject people, I'm told that apparently you need some specialist skills to do that. So that being the case, then that we need to source those, but we wouldn't necessarily need them on our staff forever and a day. It will be for a defined period of time, and then obviously probably other systems will take over in due course. So yes, so I'm not sure if I answered all you could, but it's been certainly, I would say that we are facing probably the most severe challenges on recruitment activity as it is at the moment, because of the responses our services are now trying to make in preparing for the second wave and beyond.
Sorry, just thank you very much, but very quick follow-up is the fact that we are having that the recruitment drive and the we're having so many applications, is that impacting on what we can deliver?
At this stage, I would say that the majority of well, actually at our strategic management board today, we were going through effectively the service status of all the council's operations, and with the exception of only a few services, we are pretty much running all the services that we have been over recent months. So where before during the sort of the first lockdown, we did shut quite a sizable amount of our operation, whilst we were adapting it to be able to deliver them differently in a more COVID secure way. Well, now all those adaptations have taken place, people have returned back to those roles. I would say the majority of those services are continuing. Now, recruitment activity will impact if we can't get the throughput going, then obviously that could have a sort of a medium-term impact on delivering some of the key challenges that we face. But Sally Hopper, our Assistant Director of HR, has got this as almost like the top priority that she's focusing on the moment, to be able to sort of to speed up that process on behalf of all our departments. Tina, did you want to come in there?
Yes, can I just follow on with that? Obviously, if you've got temporary staff, it's going to cost more anyway. So presumably staff cost will go down on that. But I wonder, have you, out of the people that were redeployed, have any decided that they like the job they were working on as a deployed person than the one they actually...
Yeah, no, it's a great question. And yes, we have definitely had stories and examples of that. There was one of my management team was just the other day referring to a story where there was a member of staff that was, they were doing their job and there was no sort of performance issues, but they were a bit in the doldrums, been in the role for many years, didn't really know what they wanted to do other than that role. They got redeployed and it was like opening up their eyes to, oh, there's this other world out there, and I have got skills that are useful than just the job that I've been so used to doing all these years. And there are many examples of that where we've been able to either, we will be able to facilitate those redeployments or secondments or opportunities for people to apply for roles in those jobs on a permanent basis. So that's been, we try and look for positives in everything we're facing at the moment. That's certainly been one of them.
And the other thing is, I think I heard you say there was no need for food distribution this time round. What evidence have we got for that?
Oh, sorry, apologies. There's no need for food distribution that's being led by led by the council. So the expectation will be that there will be either through a partner, I think it's Bid Foods, would undertake deliveries based on need, or there'll be access to priority supermarket slots as well. So I believe it's just not us effectively packaging, distributing to people's homes food with HCC staff.
Well, thanks for clarifying that. Thank you.
Thank you so much, Scott. That's been really very helpful. I'm just looking around. There's no obvious supplementaries coming forward. So what I will do now, thanks Scott, as I say, appreciate the time you've given to us. Know everybody's extremely busy. We'll go now into the break that we have got on the program, 10 minutes. So it's 15:20. Could we be back ready to roll at 15:30, 3:30, please? Once again, please, cameras off, mics off. See you in 10 minutes. Thank you very much.
Chairman, just to confirm, we're live again.
I think if we could just bear a moment or two, David Andrews, the chair of the topic group, has just experienced some minor connection problems. So hopefully he'll be able to rejoin us, and then we can move into the summary and member debate. We're still not able to have David with us at this point. I'm just wondering for the next section whether I'm going to undertake this the summary of the afternoon's findings, whether Nigel or Lynn, as David's vice chairs on OSC, would just be willing to step in.
If you like. Yeah, either of us, I think.
Yeah, I'm happy to. If
I'm happy to.
So all I need is for one of the vice chairs to offer up just a temporary chairing arrangement till David is able to join us, and then the other members of the topic group to confirm that they are happy with that arrangement. So I just need one name in the frame. Thank you.
I'll go with it if that's okay.
And I'll need confirmation from the other members of the topic group that they're comfortable with that.
Yep. Okay.
Okay. So without the benefit of a chairman's script,
Yep,
I believe the next thing is.
I'm back in the room.
Oh, he's back. Excellent. Thank you, David.
You nearly lost your chair, David.
Phone. I don't have the benefit of the full screen at the moment. Yeah, sorry about that. I've been having computer problems, and my computer finally crashed completely on Tuesday, and the new replacement is not performing as I would hope. Can you hear me?
We can.
Yes, we can, David.
Yeah.
Are we good? Okay, good. There was an ominous silence there. Okay, have you started your summary?
No.
Or was you in the process of doing?
So do you want me to kick off now?
Yes, please, if you would. Thank you.
Okay, so what I will do is I won't summarise the morning's deliberations because I did those just at the beginning of the session. So what I will do is I will pick up on the contributions made this afternoon, and it would appear to me that from the evidence you gathered this morning and the further evidence you received this afternoon, that it looks as though you've got 3 areas where your recommendations are shaping up. So with your agreement, I'll canter through what you heard this afternoon and what you questioned, and then run through those 3 recommendations. So if you're content with that, I'll just kick off so that we can try and keep David's connection going for as long as possible.
Yes, please.
So you started the afternoon hearing directly from the Local Resilience Forum, the Community Reassurance Cell, which is Linda Hazy. So she was able to provide that experience, plus also the experience of being a district leader as well. And you heard about the formation of the cell, how it had come together, some of the specific work that it had undertaken to ensure that members of the community felt safe, for instance, to use taxis, and how the cell is hearing from witnesses and building the findings of any surveys into future work with the community. You heard specifically that they've already done work with BME community members as a priority group, and will be continuing to move forward on that, building any lessons learned either into their own work or feeding that into the work of other cells. Not surprisingly, Linda identified isolation and loneliness with the consequent mental health implications as part of a concern for the community cell, regardless of people's level of vulnerability or not. You heard that the Hearts Leader Group met weekly and then fortnightly and decided to form the Community Resilience Cell, made up of volunteer leaders whose work you were given assurance is feeding into the work of other cells, so that kind of data and soft intelligence is informing the work of the wider Local Resilience Forum. Again, you heard that partnership working has been a vital underpinning of the work of that cell, and in fact members had been asking this morning about what will happen to some of these great partnerships that have emerged during the pandemic, and Linda was talking about the duration of the cell will be around 18 months, but that this will be evolving and responding to what changing needs is, and potentially that personnel will change. And I thought that was quite an interesting model to hold on to in terms of what any future partnership working across the voluntary sector, across local tiers of local government and with NHS and other partners, that it won't be a static arrangement, that there will be need to be flexibility to respond as changes happen. Then you heard from the Director of Public Health, and again, some of the consistency from this morning and what Linda Hazy was contributing is that a number of the initiatives and approaches adopted by Hertfordshire that we found have worked quite successfully have been then picked up elsewhere nationally to inform how other local areas would be responding. And I think you also heard a bit from Jim. He didn't use the word embedding, but I think it was an expression that Scott used. But he talked about the work of his public health staff and his consultants working within initiatives and structures to ensure that each of those local resilience cells or projects had the input from public health at the time that it needed, rather than it being a later bolt-on. Just in terms of what Hertfordshire has done that's seemed to be effective, and again was a first, is for instance setting up the schools helpline, which I know schools have found it really helpful to answer some of those tricky questions where guidance wasn't quite as clear as needed in schools. In terms of any lessons learned from around the messaging, is that Jim McManus, the Director of Public Health, presented, I thought, quite a thoughtful walk through the data. That the data is only as much use as what it's being used for. Data collection in itself is a nil activity. So he's talking about the challenges being having good data analytics to understand the data that you're being presented with, the use of that data, and then how that might inform certain projects, and particularly the type of comms. And he was talking about that sometimes the formal communication has been less effective than the regular press briefings, or those specific activities that you heard about this morning in terms of work with younger people, or how to reach older vulnerable people who are feeling a bit nervous about going out or seeing loved ones. Again, in terms of partnership, I think we've had a focus very much within the Hertfordshire boundaries, but Jim's started to articulate the way that public health in Hertfordshire is working on a regional basis with other public health members in terms of how to build capacity and understanding of track and tracing. So I think that there was, I know that members would find that assuring or reassuring that we are seeking information on how best to progress across the board, not just keeping everything within Hertfordshire. And also that Jim was also talking about, again, reinforcing some of those messages that no one entity can be responsible alone, that this needs to be a collective action across organisations. So, for instance, using when there is a vaccine developed and how that might then roll out into mass vaccination, will require something akin to the local resilience forum, working together using the logistics that are already clearly in place to help that implementation. In terms of resources, you had a full report from Scott and the resources staff. What he did mention particularly were that there had been some great lessons learned for resources around the agility of working that can be picked up for the future, and empowering staff to make decisions, but ensuring that there is good governance process around any of that decision making. You were told that not everything worked, but I don't think you were expecting that to work first time. But what you did hear from Scott, that if it didn't work, there were lessons learned that were then applied to other aspects of the work of the resources department. That partnerships and networks already in existence were rapidly utilised, so no point in reinventing the wheel when you've got some good solid partnerships to draw on, and that new relationships have grown. And he mentioned in particular work with the military that's been very successful. In terms of the current lockdown, you've heard both here and at the Overview and Scrutiny Committee about the redeployment hub, but as services within the authority are being maintained, the capacity to draw on staff from other departments is less available, and that there may need to be a review of how that's undertaken in terms of reprioritising staff to support frontline services to continue to deliver those valued services. There is the need to gear up, and already preparations are kind of being thought of in terms of mass vaccination or whole town testing to ensure that's delivered. And you heard some of the mobilisation that Helen Maynooth talked about this morning, which links back into the ability to do that, and also what Jim was talking about in terms of capacity and logistics issues. In the same way as the redeployment hub won't operate in the way that it did do, Operation Shield will also be learning lessons from the previous lockdown in terms of how that can be refined to ensure that it's delivering to those key individuals who need that service. And there was a question around a comment within Scott's report that working at pace can have a financial cost to it. But actually, this needs to be balanced out. Scott was saying against the need to have that rapid turnaround of service to make sure that we're not leaving people without essential services, but actually that at the end of the day, the speed with which that is done has probably saved finances further along the line. The final few points just from Scott's report were that what's happening in terms of reviewing and holding on to any lessons learned and how those are managed. You heard that Resources already has a project management office, and that one of the assistant directors in Resources has already undertaken a very extensive review of Operation Shield. And you had the assurance from the director that for all lessons learned, owners are identified so that there's clear audit trail within that, if I could use that expression. And that in terms of the Nightingale courts, because that featured in a couple of the questions from members, is that if required by the Ministry of Justice, they can reopen. On the basis of what was considered this afternoon and your focus of questions, it strikes me that there are three areas that the evidence falls into, and one of those is obviously around partnership working, because you returned to this a number of times, and that did feature in a number of the contributions that you had, and it seemed to run along the lines of maintaining that you would seek the maintenance and building on of further resilient partnerships, especially around emergencies, with existing and new partners to not lose the good work that's already in place, and position the authority both for ongoing pandemic issues but potential crises in the future, if I could use that word. And then secondly, there was a lot of debate around the work from the community and voluntary sector, and how the change from commissioners, which is adult care services, had enabled those organisations to come together and work more as a cooperative than as in competition, which was the phrasing that they used. And I would suggest that you would be looking at how ACS can be required to look at creating opportunities to work to enable community and voluntary sectors to work with the department and together to work jointly on funding, and review how funding allocations to community and voluntary sector can lead to cooperation rather than competition. And you might want to consider whether that is actually something that you would specifically wish to target to ACS, but then have a more general one in terms of that might be something that the authority itself might be minded of. Because certainly public health also commissions services as well. So if it's working for ACS, it may be something that you wish to follow through. And then finally, innovations, which is something that features on the scoping document. And again, you've tracked that through the questioning that you've undertaken today, is something along to identify how innovations and the agility shown can be built into shaping our future and other service plans, the service plan initiatives to achieve that and maintain that kind of agility, and hold on to those innovative approaches to services. So that's me finished, David, so back over to you.
Okay, many thanks, Natalie. That was a quick canter. Any comments, members? Comment, yes, please, Nigel. Carry on.
Yeah, thanks, Natalie. Your list virtually matched mine, so that's great. I had a couple of other things, or sort of slight tweaks on what you came up with, which are under the partnership working. I'd written down we need to maintain the networks, but we also need to look at data sharing going forward, because that's obviously something that has worked quite well, and hopefully we can find a way to capture that and make sure it's not lost. The other thing that I'd written down, which is sort of under that, is the emergency planning, which you mentioned as well, whether we do need to look at a revised resilience plan for the county with this sort of pandemic situation in mind. And I suppose, actually, I just realised one of the questions we didn't ask, which I meant to, which was whether we actually had whether the Operation Cygnus, which sort of got dumped nationally, whether any of those learnings had been fed back to the county. I think maybe it's something we pick up in a future strategy. Maybe we look at a future scrutiny rather when we look at the care home situation, possibly, because it's probably more relevant there. And the final one I had was a relatively small thing, but I think quite important, was the thing that I highlighted from Kate Bellini's presentation on the way that we can get the NHS working even more with council and voluntary sectors going forward.
Yeah, I think that's that last point is a very salient one, Nigel, because the NHS are not. You could form the view that they're not actually had a great deal of practice in working with other sectors, and but hopefully they might appreciate, having done it now and being forced to, they might appreciate there's value there, and we should be capitalising on that. Yeah, I think that's a fair comment. Anybody else? I've got no chat. I've got no chat option here, so I can't actually see if anybody's indicated. So
yeah,
if
I've got down, I'm afraid. Sorry. If you've got Nigel, you always end up with me, don't you? Yeah, just a couple of bits that I think came up a lot, but wasn't in the recommendations, and you've done a brilliant job putting that together, Natalie. But the one thing I was worried about losing, because I think it came up in so many of them, was about digital poverty. And I think if we don't actually put it somewhere, it could be lost. And I know we've got this other group looking at it, inclusivity and all the rest of it. But I think if we're going to come back and challenge our findings in 6 months, I'd want to actually know how that's going on. The other one was about where we mentioned about funding, but a few of them mentioned the stress of funding and the core staff needed, that it can't just be volunteers, and I think that needs to be. And I suppose my last bit was about, I am getting quite concerned about staffing levels and whether expectations are going to rise, but we're not going to be. We can't keep giving everything to volunteers, but we need to make sure that right the way through the partnerships, we have ample staff to enable us to do what we are. So thank you. Sorry, I heard a ding, but thank you, Nigel.
That's the very fair points, Lynn. Very fair points, especially that one around we can't keep relying on volunteers. We do have to have an improved core. And I was thinking as well that we should have people within our organisation whose core task and sole specialisation is actually to maintain these cooperative links with the volunteer sector, so that we've got that on tap immediately. And whether that's by directorate or whether that's a team that sit together, I'm not clear, but certainly the ability to quickly and easily set up those something like the team, the cell that Linda is involved with, I think makes a huge difference. And as we saw in this early stages of this pandemic, 2 weeks can make a vast difference. Anyway, that's enough for me for the moment. Jeff, are you
yeah, comment? If I could just add a comment. Yeah, I think Natalie, as Nigel said, has summed it up very well. Partnership working, absolutely key. I think that's probably the number one issue to mention. Totally agree as well with the NHS working with County more. The other one I've got down was the digital exclusion issue. I think Lynn, you mentioned it. I think you called it something different. If we meant the same, but that that is I don't know how we resolve that, but of course that's not us to resolve it. It's just us to highlight it, I guess. But I think it ought to get a mention somewhere in our response, because it did come up a few times.
Yes, you're right. Okay, Tina, are you wishing to talk to this?
Well, I think you've actually covered most of the things. I think the digital one is the one that concerns me most. That we really have got to get to grips with that somehow. I don't quite know how, but we have to.
I think.
Go on, Nigel.
Sorry, David. Yeah, I just think there's a couple of issues intertwined with that. One is how do we reduce the digital poverty or the digital exclusion of those that don't have access or can't work with it. Obviously, there's an education part of that. There's also a resource part of that. But the other thing is making sure that we don't leave them out because all of our communications are digital. So I think we do need to capture that, because that did come out from both the reports and from the discussion, that there were potentially opportunities to do a better job, perhaps, of targeting non-digital information, using particularly the voluntary sector, who've got the networks that we need to access the right people.
You're absolutely right. And, to be able to sit down and just type into Google something and get 130,000 responses, and Hearts Help is at the top of it, is something that we do many times a day. But there is a proportion of our demographic that are not in that position, and we've got to cater for them. The other thing that came up for me, this is a comparatively distant point, but is around the evidence we heard fairly early on about the pressure on carers' breaks. I don't know that I necessarily want that to go forward as a recommendation, but I don't want to lose sight of that. The getting breaks for carers, because there are all sorts of health and mental health and bigger societal issues around that. And the other thing for me generally was around the resilience element, which presumably comes under community safety. But over the years, I think I've detected that our commitment to resilience has either reduced or it's gone somewhere else, probably under Daryl, into his work. But I would like to know more about that and how that was able to, what we could do with the resilience to make sure that we've got a high level of response next time round. That's me done for the minute.
David, just adding on from to the digital bit. I thought that was really interesting what Linda was saying about these gram pads, which I've never heard of. I just wondered whether that some sort of inclusion there in our response. I think they sound like a really good idea, and it might certainly help towards resolving this whatever it is, 10% of excluded, digitally excluded area. But yeah, gram pads sound very good.
Yeah, you're absolutely right. And as I said in the discussion, I've got family understanding of that, with helping certain generational members get through that initial hurdle and distrust. Once they're bought into it, they're upgrading their tablets quicker than I am. Yeah,
no, I've got exactly the same issue as a family with a family member. Yeah, quite agree.
Okay. You've captured those, obviously, Natalie. Where are we with this now, recommendation wise?
So I have captured them, and I'll just go through them in a minute. I would suggest that the topic group agree the usual practice, which is, having agreed the areas in which the recommendations fall, is that they leave the fine tuning of the word to you, so that we can make sure that we are able to get the draft report that substantiates the recommendations appropriately. The structure of the report, for those who are less familiar with our topic group reports, is that there will be a background which will contain the evidence that supports the recommendations that you've arrived at. There is also a conclusion section, so it's always helpful to think that you don't have to have everything going into a recommendation. Some of the things that are important will appear in a conclusion. They're not quite a recommendation, but they're still something that you as a topic group would like to draw a focus to. Just running through the areas that people have identified, what I would suggest is that Nigel talked about partnership and emergency planning and the resilience around that in a wider context, and the NHS. I think that that is all wrapped up in that partnership recommendation. And I've also picked up your data sharing with that as well, Nigel, because I think that that was something I missed off. So and clearly that is important, and Jim talked very eloquently about that. So I believe that the recommendations we've got capture those, and that those will be more articulated within the report itself, but that will feature there. In terms of the digital exclusion, I would suggest you probably do want a fourth recommendation so that it stands alone, because I think that is an issue, and that would enable us to reference the specific comms around that as well, because I think there were a couple of issues around digital. One is not being able to use it, not having access to it, and there's other that as services develop, and particularly this topic group has taken a focus on innovation of services, that there doesn't seem to be an inevitability about going to digital for everything, that some of those more traditional communication routes are maintained. So I would suggest that would be the digital exclusion, poverty, whatever wording we come up with, that is included in that. I think the funding of stuff, I do wonder if that's a conclusion, because I think it is important, and also the staffing levels to deliver are not just based on volunteers, because I think there could be, again, as Lynn was saying, something of a reliance there. Then there were some other recommendations which I think I've spoken to, which is partnership, NHS working. I would suggest sits very comfortably with the partnership working. I've talked about digital. Carers breaks, I think, is a conclusion, because I think it's a bit like the resilience around organisations that we've talked about, and the resilience around emergency planning I spoke to earlier when I was suggesting that I thought went into that earlier recommendation I made. So hopefully members from that I've got that I've hopefully picked up all of the areas that members were wanting to see featuring in the report.
Yes, I agree. Comments, members.
David, if I may, just on the funding conundrum with or commissioning services from the voluntary sector, I think it's going to be quite a tricky one to work out, and I do wonder if it's something that we probably ought to be recommending that somebody, I don't know from where, probably from ACS, goes away and does a bit of work investigating options on this, whether we can take away that competitive model that we've got or we had before the crisis, and replace it with something better. It's not going to be easy, because money's always going to be tight, one suspects. So
Nigel, I've got some wording here which includes review the funding allocation to CVS to lead to cooperation rather than competition, which I think is what you're driving at. I've captured that.
Okay, good. And I suppose the slight, maybe analogous comment is there's one in relation to what Scott was saying about the balance between doing things quickly and not and maybe spending a little bit more money in the short term and taking forever about it and spending even more money in the longer term, and whether there's a lesson to be learned from the way the council operates all the time in speeding up the way we do things. That may be a personal view.
Yeah, you're absolutely right. And of course, when it comes to procurement, we have all sorts of traditions and customs and regulations embedded in every element of procurement. More regulation these days, I fancy, than most. And there needs to be a point at which point a time comes where you say, no, we're going to stop the formal process and just move forward to put in place quickly what we know we need. So that's a difficult place to get to.
Yeah, I'm just thinking whether
you're right.
Scott's review, however informal, provides us with a little bit of ammunition for the. I'm sure I'm not the only councillor who gets a little bit frustrated by the length of time it takes to get anything done, particularly in highways.
Oh yeah, but yeah, I granted, but yeah, I mean, we're talking about crisis situations now where you have to be seen to be acting quickly. So yeah, how do we circumvent the normal bureaucratic process in the interest of quick, effective interventions? I think that's certainly something we should look at. Okay. Any other thoughts, colleagues? Apart from save up your pennies and buy David a new computer. It's all gone quiet. I think I'm lost.
I think we're done, David.
Yeah, I think just want to say thank you, everyone.
I thought I'd lost you. I thought I'd lost you there, but wise words, Jeff. Okay.
Well chaired, David. Despite the IT issues, very well done. And I tell you what, I thought it was an absolutely extremely interesting day.
Yeah.
Totally
agree. It's one of the best days I've had in a long time. Yes. Well, thank you. Thank you.
And thank for the officers. Thanks, I think we had an excellent lineup of witnesses. Superb.
Yeah.
Well, I know we get frustrated sometimes. Yeah, I know we get frustrated sometimes at the length of time that it can take to bring a scrutiny forward. But you're absolutely right, Jeff. You've identified it does take time, and it takes considerable skill to get all these people together and to do it under these circumstances. Now, I mean, there are too many people to thank. I'd be here for another 25 minutes. I'm going to thank you as the members for your input and your concentration. I moved to have a break every hour approximately, even if just so we could get up and walk around and get a bit of a sanity break. With your blessing, I'm going to write probably now Monday. Do I have your blessing to write to each of the contributors today, thanking them for taking time away from their primary tasks, which we know are pressing, and taking the trouble to come and talk with us and give us an insight into their work? Do I have your blessing to do that?
Absolutely. Yeah. 100%.
All right. Well, that's to keep it short today. That's what I will do. But obviously, we've got officers here today. We've been very, very well supported by Fiona in the background. We've hardly seen or heard her, but there's no Democratic Service input today. It's Fiona that's been doing those tasks.
Yeah.
And of course, we've got our producer, who I'm hoping is taking a metaphorical bow as we speak. Thanks to him for keeping us on the straight and narrow. And I've got to go away and find another computer. But on that basis, at a little after 4:10, I'll just put it round the houses quickly. Nigel, you've always been first. Any final comments?
No, only to reiterate your thanks to everybody who's participated. It's been really helpful.
Okay, I'll put that in writing to them. Tina?
A very interesting day.
Yeah,
interesting day.
Lynn?
No, just to say thanks for the chairing, and I think it's been interesting. It's been good. Thanks to everyone.
Super. And Jeff?
Yeah, I think I said my piece. Yeah, fantastic day, and many thanks to yourself for chairing and for the officers for a superb lineup.
Thank you.
Well, in closing, if I may, I'll just thank you all for, as I say, once again, your commitment, your patience, and your you've done us proud. Thank you very much. Okay, at 4:10, I shall wish you a good weekend, and we'll catch up on the other side. And if you've got any queries or comments that you want to add, please get in touch with me, so that we can discuss them. So on that, thank you. And at 4:10, good night.
Have a good weekend.
And everybody.